is on the live stream. Can I remind people to use, wherever possible, easily common language, let's say. Let's try and reduce our abbreviations as much as possible. And if we're going to use any, try and explain them so everyone can actually understand what we're talking about. I can start with apologies. I've got apologies from Ben Ansell, Nicola Bent, but I think I've got Richard with us, Richard Booth. Good to see you on the screen there. Ian Gerling, Siobhan Harrington, Paul, I think Paul Johnson had apologies, but you're with us.
I am.
There you are. There you go. Good to see you. That's great. Gillian Kay, who's got Kelly Dean here for her. Hi, Kelly. Rebecca Knox, Teresa Levy. Alice Deacon is attending. Hi, Alice. Good to see you. Andrew Rosser, David Sidwick, Debbie Simmons, but we have Pam with us. Hi, Pam. John Sloper, Rob Whiteman, and I had Simone Newell, but I can see Simone on the screen, so welcome, Simone. I think across the screen, well, I won't introduce everyone on the screen, so but I think we can all see who's with us there. And I won't introduce other people who are just here for meetings. I will ask them to introduce themselves as and when they speak, if everyone wants to tag us back. So can I ask for any declarations of interest? I'm not seeing any, so not on the screen, so thank you for that. If any should arise during any of the topics, please do mention them. I don't know if that was something in the chat, Simone. Was that something related to declarations? Okay. Oh, good morning, that's fine. I can't read it from here. Okay, so if we can first then look at the minutes of our last meeting and take us just through those minutes. Does anyone have any corrections or edits to those minutes? In which case we will take them as an accurate reflection of the meeting. So thank you very much for that. And then if we move on to the action log. I can see that all of the actions there are presented and recommended for closure. Is that correct? Anyone want to add anything to those? Several of the items will be here today. No. This is good. Great. So if we can move on to our first item for decision, which is about the terms of reference. And we have just a minor join. Okay. Just a month. Find anyone. So has anyone just joined Teams? No? Okay. Usually it's it probably was. I'm going to blame you, Andrew. Yeah. Okay, so a minor update to the terms of reference. Liz, did you want to speak to this just to... It is what it is.
Well, very quick. Just to say that we've been informed by Dorset Council that they would like to extend their membership of the ICP and adding to their 2 executive directors and the Health and Wellbeing Board chair, who are already members, to also add their cabinet member for public health and housing to their membership to the ICP. That's the only amendment to the terms of approval.
I thought under the GP representative, it just says 2 representatives. I thought we were more specific in that it was chief executive of the the representative from the GP Alliance.
Okay, that's obviously not what was reflected in the document, if that's what you would like it to be.
I think that's what was previously agreed.
Okay. Jenny.
On a different point.
Okay. So do we need to amend that representation you're requesting that we amend that representation. Okay, we can do that. You can make that change. Jenny?
So it's not to make any change to the terms of reference, but I notice in there it does talk about the ICP bringing or producing even an annual plan and review. And I'm conscious we didn't do it at the last meeting. It's not down for this meeting, so I'm not sure when we're planning to do that, but we probably just need to make sure that we're building that into our agenda plans.
Thank you for that. Okay. Sandra, could you repeat the what you wanted to say?
So the two representatives, one's Chief Executive of Wessex Local Medical Committees, and the other one is representation from the Dorset GP Alliance.
Can I ask that we agree that now, so the terms of reference don't have to come back again?
I think it was agreed at the last meeting, actually.
Okay, so maybe it wasn't just action done. Okay. Yes, Paul.
So that's Richard.
Right. Oh yes, I can see. Yes, I can hardly see a hand there. Sorry. Yes. Richard.
Sorry. Yes, and but this is a really minor thing. So, but it's the Wessex AHSN. Our new name is Health Innovation Wessex, and as if this is an opportunity to modify that and without causing further delays to this bit, that would be great if we could just change the name from Wessex AHSN to Health Innovation Wessex. Thank you.
I'm certain we can do that, Matthew.
Thank you. So. I'm thinking about the issue of local authority representation as reflected here in the terms of reference. I'm fully supportive of the suggestion from Dorset Council. It sounds like a very good suggestion to me. I'm just wondering, and we may not be able to resolve this today, but whether that leaves potential inequity in the room in terms of BCP, and I wonder if that's a question to be taken away and for a discussion with BCP colleagues.
I think BCP colleagues are aware of what the new representation from Dorset Council is, and at the moment have made a positive choice for all of this. But certainly, it's something that we should keep under advisement to make sure that they are content that they are not underrepresented. But it is a positive decision. They are, Gillian and Graham are fully aware of this as being a representation. So again, I think it's for them to.
So Cecilia, I'm very happy to leave it at that response. I'm not sure that, and I kind of say this with no comment on any partner in the room, but I'm not sure that that's entirely a one-way conversation. In that I think some of this is flat sort of how we want to be as a system, and I suppose I'm just advocating for the importance of local authority engagement, and therefore I think this is a question for consideration as we go forwards from here.
Thank you. I will take that and note and have a further conversations, as you say, outside the meeting to see what we should do. Any further comments on terms of reference? Thank you. I know it's always a administrative point, but it is useful, as you're suggesting, to make sure that we have got the right level of representation. Thanks, Liz. So now we come on to the main part of the meeting, looking at we've got a number of issues that we're going to be looking at. We've got housing. Then we're looking at the cardiovascular disease, respiratory and falls, looking at employment and looking at social mobility. And I think as we are focusing on all of those non-medical aspects related to health, I think what we're trying to do is look in the round of a lot of the issues and what partners are doing and where partners can lean in, get active and get involved in things that are already in train, or support or challenge things that perhaps aren't happening. I think we look at this again from a view of how it's part of system working. And I think for me it is, but I think being very clear as to why this paper is here and how that relates to to our strategy and system working, and what, if anything, others can be doing in support of it, what the gaps are, what it is that will actually help us take some of these issues forward. So I think we've got Andrew and Kelly. Are you going to take these forward for us? Okay. Do you want to just initially introduce yourself before you start?
Certainly. I'm Andrew Billany. I'm Director of Housing and Community Safety for Dorset Council.
And I'm Kelly Dean, formerly not so long ago known as Kelly Ansell. I got married, not divorced, just
Congratulations.
on this occasion. And I'm Director of Housing and Communities at BCP Council.
Great. Okay. I'll attempt to join the meeting and try not to cause mayhem to the system. Because what we've done, I mean, what we've done for trying to reflect in the paper that you've all seen. I'm not trying to get the slides up, but I can talk to the main points that are in the paper. Is to reflect, as Cecilia started to talk about, where there are links across the integrated care partnership between housing and health, and certainly people like Sam have been very eloquent about that kind of wider determinants of health and housing being at the core of a lot of that. So what we've tried to put across in the paper is a description of the direction of travel through pretty good joint conversations across the system, and including the conversation at the last meeting where we probably ran out of time in terms of the number of points that were being raised. But just wanted to and Kelly and I clearly stay close on this because this is a Pan Dorset set of conversations. So I just wanted to remind everybody where we were at last time around the key themes that we drew out, and going to put across what's happened since then in terms of a proposal to segment those themes and get them set up into a series of projects that gets progress. Otherwise, we end up having lots of interesting conversations and not actions. So key themes very swiftly, splitting up. So we're not just talking about what do we do about housing. It's about how we deal with each of those themes. So housing solutions to prevent ill health, hospital admission specifically. What are we doing around good housing decisions to make sure that health prevention piece is done well, and also at the other end, further down the line, supporting hospital discharge to getting the right housing solutions. That might be a new home, but more often than not, it might be a conversation with the landlord to get an adaptation together.
Andrew,
Can I just say,
just a little bit louder with
yes,
the
I was
noise.
going to say,
Sorry.
well, no, it's just the fact that we've got this drilling going on.
Okay.
And so I don't,
I'm already
can people online hear okay?
too noisy.
Yeah, it's fine, yeah.
Okay, and Sam, down at your end of the table?
It's a bit quiet.
I'll speak up, Jenny, and everybody else. Okay, so the first theme, just generally, it's around making sure we don't lose track of what is the main part of our day job, is making sure we're dealing with housing solutions to people who are ill, or preventing people being ill, and then getting them, helping them get better. A lot of activity and themes around what we do about new housing, given that Kelly and I both got a role about facilitating new affordable housing in particular, and that to make sure we can do the best as a system to get that right for health and social care needs. Where we started with the housing roundtable discussions, which have been going on for about a year now, was a discussion about essential workers, key workers, essential workers, employees of all across the public sector. So that remains as a key theme. How are we dealing with getting existing homes let to and available for current workers, but also that we get our plans together so we got earmarked some new housing schemes for such people. Fourth theme around the discussions is not to lose sight of some of the issues around recruitment and retention of workers, maybe to do with employment policies. It might not be housing, might be other aspects, but to make sure that we're looking at that particular issue in the round. A couple of more themes that we feel probably could do to be segmented is that, and Sam will talk about this a little bit in the next item, is the focus on housing standards and conditions, particularly around damp and mould, and how that impacts on health and well-being, damp and mould, overcrowding, poor housing conditions. sometimes relegated beneath some of our bigger, more red flag headaches, such as homelessness and new build. That's something that's come out as a theme that we need to prioritise. Last but not least is how we make the best use of our publicly owned land, the kind of one public estate agenda. How do we put our resources together, our capital, our land, our assets, our potential funding opportunities to get this work to the best effect. So, where have we got in terms of this discussion in practical terms? The Housing Roundtable, chaired by Matt Prosser, but obviously it's the BCP and Dorset Council piece. What I think we have achieved is a really good, positive coalition of the willing, if you like, about making sure that we've got common ground, common intentions. That's a given, and we've done good work around such as the Housing and Economy Conference that we did, that Cecilia was part of back in February, where we're looking at how we share intelligence data and also strategies around that housing and employment piece. There has been progress, and some of you around the table will know more than I do on this, but there has been progress on around joint work with NHS estates, hospital management and local authority leads as well, about how we about making best use of those sites. So there is progress. It's where we go next question. What we're going to discuss on the meeting on the 4th of September, and we're really keen to get comments here today, as both Kelly and I are, is about how we speed up and resource adequately this kind of work, because I think we both Kelly and I have got a pretty demanding day job around homelessness and dealing with housing need and the statutory responsibilities. We're all signed up to this, but how do we gather up ourselves to get pace in some of these streams if we still continue to see them as important? So what I put in the paper, what we put in the paper is what we propose it to do as a next step of Housing Roundtable conversations, to segment the pieces of work into priorities. Sorry, segment the priorities into a programme of work so that we are giving it proper, more focused attention. Say, rather than just seeing this as a very broad brush conversation about housing and health. Is the extension the 4th of September is to get that segmented into a programme which we will continue to feed back into this, the ICP, Integrated Care Board if requested. So we've got that tight oversight from an integrated care system as well as our own respective authorities. Probably leave it there. I don't know if you want to add anything, Kelly, but I think the main reason we've been asked to come back here today is just to continue that conversation we started last time, so we can shape and inform how we both put all this together.
I would add is around there's an awful lot of work that's already happening from the point of view of both housing authorities and across the system in many ways. I think it is about making sure that we have clear priorities that are worked into, as Andrew said, some clear work groups, sort of task and finish style working, so that we can focus and recognise what we already have, where the gaps are, and what our priorities are going forward.
Thank you. If I can start, I mean, has anything that the new government's come out with made any changes to the way that we hear a lot about changes to planning? Is that going to have a positive, negative impact on the work that you're already doing?
I think it's too early to say at this point. There are a number of different elements of new policy that we might expect. But yeah, it's definitely quite early at this stage. I have got a summary actually, which might be helpful to circulate around. But again, until we see the detail, I think one of the things that's really interesting is what the proposals will be around how things like what was previously named the Renters Reform Act, abolishing section 21 evictions and not fault evictions, and how that's to become the Renters' Rights Act. And there are some issues in that in relation to the constraints that we have across the private rented sector. And that causes a natural pressure in the system, particularly around homelessness and those sorts of issues, and could also, kind of create more difficulties in terms of housing standards in the private sector. Lots of landlords exiting the market, lots more regulation, much more difficult for landlords to operate in that space. So I think that's going to be an interesting one to follow. And the other one under the previous government was a piece of legislation around regulation of exempt accommodation. Exempt accommodation is where additional housing benefit can be claimed, where some sort of care or support is provided within an accommodation setting, but it's never been regulated. The evidence that's required to get quite a significant uplift in therefore it's a great income model. That's never been regulated previously, so we're waiting to hear what the new government will do, because there was talk of licensing of those schemes, and also, which would be a local authority regulatory role, and then that would come with a fee that each landlord would have to pay, potential costs that ends up being passed on to tenants, of course. And then the local authorities are required to write a supported housing strategy. And that supported housing strategy would have to take account of all of our specialist housing needs, both what's commissioned at the moment and what's out there, because all of these units of accommodation which are in this exempt category are typically not commissioned. It's just a lucrative business model. So it'd be interesting to see how those things emerge. And then, of course, there's the real big stuff around planning, changes to compulsory purchase.
It's just those 20,000 houses that we know across the county have got planning permission, and yet they're stuck somewhere in the system and not getting built out. And you can imagine that would be quite transformational.
The strand of work we got going with the housing development side, I'll shoot from the conference we had in this work. So that's again, it is a cautiously space. It's a big government are promising it as a big game changer. Just briefly, I just add about everything Kelly said. Absolutely, it's just around that relationship with private landlords. It's about whether we can more than happy to have a conversation about how we approach lettings agents, private sector together as a system, because that's it's a very hostile environment for landlords at the moment. I'll be honest.
Yeah.
So renters reform great for tenants, perhaps less great if you're a landlord. So we can may make sense for us to talk about how we approach those landlord sectors together as a good bet, a safe bet. Long leases. That's kind of perhaps an easier option for them. So that's just reacting to actually something that is actually more difficult at the moment for landlords, and that's a problem for us.
I've got Simone, then Jenny, and then Matthew, and then Patricia. So Simone.
Good morning, Simone Newell. I'm a GP and representing the Dorset GP Alliance. Sorry if this is a bit of a naive question. I was just wondering, with all of this housing, is there plans or requirements to provide community space? I'm just thinking about the new government and their sort of drive towards, neighbourhood hubs. And I'm just wondering whether we're ahead of the game in that we think about providing community space as part of these housing plans, especially where you've got a lot of social housing, because that sense of community, and when we're thinking about developing our neighbourhoods, is really important.
I can give a go. I mean, it's broadly that's considered as part of the planning process. So for new build housing, that's certainly something that should be looked at. In some ways, it's more of a challenge for existing, perhaps older estates or older properties where those community facilities might be tired and old. And, so it's a good question. It's probably something to always encourage people to feed into that planning process to make sure there are enough provisions for infrastructure. It's always a case for a challenge to new build schemes is where's the infrastructure, where's the community capacity. So I've got an easy answer to that, but it's a fair one, and it contributes to wider community health.
But I'd just add to that, that comes back to that role of planning in the conversations, and BCP were just at the final stages in terms of adopting our new local plan, which will consider some of those needs. But there are other elements that across the whole system we need to really think about, like we have community infrastructure levy, which can be used for community projects, community led and community, owned, but then you've got strategic community infrastructure levy that supports some of the things that are needed in terms of development. And I guess it's a question within each local authority area about the use. When we come to talk about use of public land, it's also about resource and how that all comes together. So I think it's about making sure that we've got strategic planning as part of, framing those early conversations.
So if I go, Jenny, Matthew, Jenny.
David's got his hand up as well. Thank you both for Andrew and Kelly for the paper. I think it sets out the issues quite clearly. It also talks about the need to prioritise, and I just wanted to endorse the areas that you've talked about. So key worker housing is one of them, and then the other one is housing links to health outcomes, because I think there's a danger with housing that actually we could go really broad, and you already play in that space. There's no need for us to be there. So I think the intention that I take from the paper is to get us to focus. So I think they're the right areas from my own perspective. I wanted to add a couple of things though to the second one, which was the housing links to health, because I do think that's where we should focus. One of the things that I wanted to add is that I did, and I think really this for me, this paper brings together the next bit that Sam is going to be doing. So again, why I think it's helpful to focus. So I opened a conference last week called Cleaner Air. The keynote speaker for that conference was Rosamond Adu Kisi Deborah, who some people will know. It was her daughter Ella who died in 2013 that the coroner ruled 2019 that the first person in the world where they've said that pollution was a factor in her death, and her daughter had really acute asthma for a very short period of time and died. And the reason I mention that is because one of the things that came out for me when I was prepping for that conference is that research shows that air pollution, is not just a risk factor for respiratory illnesses. Clearly it's in that, but actually the research shows that it also contributes to 50% of cardiovascular deaths. I never knew that, and that is really, really significant. So there's something for me about how do we make sure that the things that we are focused on are things that come together so that we've got the power of the ICP to do those things. And the links to health around housing, I think, is a really powerful link to the cardiovascular piece that Sam is going to do next. I think the other thing that I wanted to say around that focus is Professor Stephen Holgate was instrumental in Rosamond's pursuit of the cause of her daughter's severe asthma and death. And he has been in contact with me recently. And one of the things he's been talking about is the work that Will has been doing here in Dorset, because of the ability of Dorset to have the dice to really focus down at the population level. So I wonder if one of the things we might want to do is actually allow the data to drive us in that focus around the areas that we want to focus on first. We don't need to reinvent the wheel. We should be able to really look at what's happening around population health and housing within our locality. And then probably the last thing for me is about just linking that air pollution thing is about where housing is. Because obviously if you're in areas where you've got a greater propensity to air pollution, then that's going to be an issue. That might link into your later piece around housing development, but it might be something that we also want to focus on now. So those were the areas that I wanted to just cover to endorse the two priorities that you've given here.
Thank you. Yeah, and Matthew.
Great, thank you. So also welcome the work, welcome the continued focus on the homeless population, which is really important in all its all the strands there. I guess just linking with Jenny's point, I I think there's something about the intersection of this with the work of the ICP and getting focus, so that what we're not doing is having the conversation across the whole of housing, but doing it in a sort of superficial way. And we're really thinking about the areas where we want to get movement and be linking them back to the strategic goals and outcomes of the ICP. And I think that that's the challenge for us. So within that, I'd just like to advocate for two areas which I think need particular attention. So one is the place of housing in mental health pathways, and particularly for patients with more complex and enduring needs. And I think, there is a lot more that we need to do in the system. And I'd be advocating to see some tangible solutions and plans on the table, which we all need to contribute to. And the second is, within this, the question of our key workers linked with what we think the workforce of the future in health and care is going to be. So I think we've got the issue of our international recruits currently, but we've also got the issue of making Dorset an affordable place for a career in the public sector, making it attractive for our children and young people, and doing that in the context of a changing model. So from a health point of view, traditionally what has happened is the acute trusts are the gateway for people into health careers. And so housing solutions tend to be planned around the acute trusts. We've got an example here in Dorchester. Actually, the model of the future is to have a much more distributed model of care away from acute centres. So how is that being built into the strategy? And how are we therefore developing our solutions across the whole of the geography that we serve?
We've got 3 more contributors, and then we'll come back to you. Obviously, I know it's not a lot of time for a very big. I think what you're hearing is interesting. Yes, we need to focus. Yes, we need to get to really nail it down. But then we've got other aspects that we also need to take into account, and that is going to be the continued challenge. But it's right to put those things to make sure they're in our thinking and our long-term planning. I've got Patricia, and then David, and then I think Andrew wants to come in. Oh, Jenny, sorry. Yeah, Patricia, you've got it.
Because you have food, nobody calls him Andrew apart from his mum.
Well, you're very well.
So just a bit of a correction in the paper. It's not an ICB approach, it's an ICP. I think for me, there's a bit of a step back before we decide on what we're going to do, because I'm not sure that everybody absolutely understands what the steps and responsibilities of local authorities are and what work is already happening and where this sort of fits in. Before we start talking about what we need to prioritise and what the resource envelope needs to be. There are sort of 3 things in my mind. Agree with the fact we need to look at key worker housing. I'm not, having had a lot of development in that space, I'm not even clear whether we've still got a key worker issue or if we have, how big it is. So it'd be really helpful to understand that. When we talk about housing to support health, I think we need to just remember the priority areas that we've already agreed. So 3 are sat in the next presentation from Sam in terms of the joint forward plan. And then connecting to Matthew's conversation, there's the right quality and infrastructure of supported housing for people with mental health and learning disabilities. I would say those are where our priorities are for the next year or 2, and particularly in the LD space, where we are all spending literally tens of millions of pounds on care packages for people because they're simply the wrong type of accommodation. So we need to get on top of that. I think in my mind, the 3rd issue then is social mobility, and homeless comes into that, affordable housing comes into that, because when we look at the parameters of 2 or 3 things that are needed to grow the economy and move away from being a low wage economy, affordable housing is right in the middle of that, in that we can create as much innovative business as we can. But the reality is, if when our young people qualify, they can't afford to live here, then they're not going to stay. So to me, there's something in that space that we need to really back. because growing our economy and moving it away from being a low wage economy is one of the keys.
Yeah, I was just going to say on the paper, I like the paper because it's very brief and to the point, which I think is always welcome in these sorts of meetings because you have so many pages to read through. And I agree with the sort of priority areas moving forward that you've got within there. And your comments about the private rented sector and the difficulties for landlords at the moment, I sort of see that in my own experience with people I know. So yeah, I completely agree that it's a really difficult space at the moment for private landlords. But what I wanted to say, in some ways it's agreeing with what Cecilia said right at the start, is that I know it's not all about new developments, but I think with the new government coming in, some of the comments and the new music about planning, but also I think the Chancellor gave a speech within a couple of days of coming into place and talked. I quickly looked up the speech, talked about particular areas to unlock stalled housing sites and some major sites throughout the country and setting up a task force to do that. And I think that's potentially one area, you know, in the VCP area, we have I suppose what you could call a stalled housing site, major redevelopment site, and whether it's needing to strike while the iron's hot, might make contact with that task force that's being formed to actually say, can we get involved in this? So I think there's potentially certain things that we need to sort of strike while the iron's hot with the changing government could help. But overall, yeah, I like what's.
Thank you. Andy?
Yeah, I think it's fantastic that we're focusing on housing, and I think there's a big opportunity here looking at the biggest proportion of our population being elderly and having a disproportionately high elderly population compared to the rest of the country. I think there's a real opportunity for imaginative housing developments that actually promote and preserve independence, but also allow really efficient utilisation of social care. So many of our social carers are spending half their day travelling around, and actually if we can really drive that efficiency, I think there's a big opportunity there. Also, I think if you have that adequate housing, it frees up a lot of the bigger houses that certainly my elderly patients are sitting in for the younger generation. I've got plenty of patients that are sitting in 5-bedroom houses and only utilising one room.
Yeah.
And one of the risks that I see from a primary care perspective is that the current core GP funding and the primary care estates is not going to be able to be fit for purpose if they have the needs of a big influx of population. So 20,000 houses will require at least 26 full-time equivalent GPs. Now, if you could recruit those GPs, the issue is there's nowhere to put them in the practices. But also the perverse funding that the GMS contract now has means that all of the funding is going into ARS staff, so practices actually can't afford to employ GPs either. So that's a significant risk unless there's a fundamental change in core GP funding.
I'll just respond to that. So you probably don't know that what we talk about in here, the one public estate principles, but the ICB has just finished its infrastructure strategy. Now the plan is to broaden that into a whole system strategy looking at the one public estate. So Rob Morgan, the CFO, is leading that work now. But as part of that piece we've done on health, we have been talking to our providers about pooling the whole of the ICB's capital budget as part of prioritising a higher level of spending in primary care to resolve some of the issues that Andy's talking about.
And I think this is, again, the reason why we've got these 4 papers coming in. They are because you're going to have, you know, the public health, you're going to have skills. Again, that's why these, and social mobility, because they are all intertwined. And I think each of us has better knowledge about some of the things than others. It's how to inform this housing roundtable. It's been meeting, but it's been meeting relatively infrequently because people have not been able to turn up. And I think we do need to put some, you know, drive behind it. That's a good word. I was trying to think of a polite, nice word, but it does, and it needs a bit of a. So how do we actually? Can we, outside of this meeting, people think about that roundtable and how we're going to contribute? Because that's where those discussions could happen. Can I ask for any last words just before we finish?
I've got a couple of, I just want about 7 or 8 really key points. Just maybe pick on a few, and I'll start with the part of the point we're going to flesh out at the round table is having a program. I mean, we've got roll our eyes about it in the program, but I think it's just having that kind of program resource to knit it together and keep it moving. That's kind of where we'll feedback how we get on in September. One couple of things to come back on just around that mental health pathway that Matthew's said as well. I think we're making steps forward around that. I just wanted to, I suppose, advocate for housing being as a prevention tool, as well as people being at the state, last day before they discharge from hospital. What housing going to do about it? That's increased. I'll be blunt. That's increased. That has been an issue. Whereas we're very keen on it. Speaking for you, Kelly, I'm sure you're the same. We're very keen to be in early as a conversation, strategically as well as operationally, about how we can prevent. And there's been some good initiatives around having housing officers on wards around, making sure we're ahead of it. That's a bit of a speech, but I think that we're making good steps. But more of that, please. And the other thing about getting our land assets capital joined up before we go to planning, I mean, I see feels key. And at the moment, we are quite opportunity led. So there's a bit of land. What should we do with it? Which takes some way forward, but it feels like there needs to be more of a strategic join up of how serious are we about this, and how do we want to align ourselves. Last thing I'll say, and I'll stop, is just that the word data has been used a few times. It's just we both, with Kelly and I, spoke about this quite a lot. It's about making sure we've pretty tight information and data on what's driving this. Otherwise, we think we've got a key worker problem, but what's it like? How big is it? What the barriers? What's the affordability barriers? Those kind of drivers. There's still a need, and that's why we're thinking about having a program resource. Is to get some detailed work around that, so we've got very precise data of what to the side of it.
I think we have some of that already, but yes, it's how to corral it all together. Thank you. It is a core issue, as everyone said. It is core across so many things, whether it's employment, whether it's prosperity, whether it's mental health challenges. It is the other prevention side program as well. That it's your prevention program, isn't it? It's helping. So I think this is the reason we put it on this agenda, is for exactly that reason. And how do we get the additional resource? So can I come to Sam next then for the again for the public health, our CBD, respiratory and falls work that plays in. Thanks, Sam. I think everybody knows who you are, but if you could introduce yourself.
Yeah, good. That's come up. Good morning, everybody. I'm Sam Crowe. I'm the Joint Director of Public Health for Dorset and BCP Councils. I'm just going to rattle through these slides quite quickly because you've had them in the deck already. Just a couple of words of introduction. I think I've interpreted the brief liberally, because the discussion that we had at Poole Hospital, I think the way it was minuted was for me to link with the transformation team and to pick up on the work of the CBD work, respiratory and falls and frailty. But because we're in the integrated care partnership, I've interpreted that differently. And I think the challenge today is, if we're going to be a partnership, and we're going to be a partnership of some large organisations and diverse organisations, what will we focus on that goes beyond some of the core NHS work, which is about efficiency in those pathways? So I've interpreted it slightly differently. And I think the comment that was made in the previous paper around housing is absolutely correct. A lot of this work happens already. The issue is that the integrated care partnership probably doesn't see it. We don't measure any of it objectively. A lot of this data doesn't exist in our forum. So I've just put these slides together as a proposition, really. And I'd be really interested in your views as to whether we should bring some of this activity into the light. And if we do bring it into the light, where are we going to focus our efforts to push on and achieve scale on one or two really key issues, particularly thinking about that link between health and housing? So just in terms of my interpretation of the strategic fit, I know I've interpreted this a bit more to be bigger than our organisations, if we're in this room, to improve outcomes, access and experience, to act upstream, to prevent ill health and tackle inequality, and to have a wider determinants focus. So it's not just about what happens within our services and our individual legal and statutory obligations. And the following diagrams, I've got to pay tribute to Polly Durant and Ellen Finley and the public health team, who took some very uninspiring life course pathways and have done some really nice graphics with a little bit of chivying from me. The way they put them together is to start to think about moving on from what we normally do in needs assessments, which is to measure all the negative things that happen to people. How many people have ill health? How many people have hypertension? How many people have things wrong with them? And to kind of cast this as positive pathways. So if we were going to work on some positive things, keep people well, what would that look like? Jenny's quite right to mention the contribution of air quality to cardiovascular disease. I haven't particularly put that in here explicitly, but it comes in the healthier communities box. So if we're encouraging people out of cars, we're encouraging that transition of public transport to support more people to be physically active and to walk and cycle. That has an impact on air quality, as do things like all of the measures to improve air quality, which I've focused on much more on the respiratory pathway. But this is a cycle of life, if you like, and it shows different life stages, and it just shows some suggestions as to what to think about if we bring the whole of the work into focus and not just what happens when you start to develop a condition, start to become ill, and start to need health services, for example. So if I start at the right at the bottom where you've got the hopscotch. I don't know if children still play hopscotch, they probably don't. But we do commission at a relatively small scale some things like behaviour change support for families. We've got the Live Well Dorset service. Scale is our real challenge. Even after 5 years, that service, which is fantastic, still only supports around about 10,000 people a year. So they've only just reached perhaps 8 or 9% of the Dorset population after 5 years. So what could we be doing as public sector organisation to build that sort of support? There is an active live survey which the government run regularly, and it provides very good information about population physical activity levels. There's also a physical activity strategy called a movement for movement. Again, it's just prompts, what are all of our organisations doing to promote that? And what's our contribution? Pause and priority is a little bit more focused on perhaps some of the assessments that need to happen to pick people up at an earlier stage. But my sort of simple summary of this pathway is that our system is very, very successfully geared to picking people up once they've fallen. How do we change that? There are lots of things that I think we could be doing better to support people in the midlife, making sure that people understand the importance of maintaining strength. Even simple things like proprioception, which is a word I struggle with, but you do start to lose these qualities in your 40s and your 50s and your 60s. How many people can close their eyes, stand on one leg, touch your nose confidently, or do what they do in...
Are you suggesting we try?
Just to pass the rock over your head without falling over. But, I don't think we talk about this stuff enough. I don't think we equip people with the knowledge and the skills at the time in their life where this could really make a difference. And instead, we respond very effectively when people fall. And, partly that's one of our challenges around urgent and emergency care at the moment. So they're just some suggestions about how we could look more positively. I want to come to the HHSRS, which might need Andrew and Kelly's help interpreting. I think this is the home hazards or home health and safety rating system, but there's information collected on the state of people's homes, for want of a better word. And I think a number of years ago, there were more people working in the community who were eyes and ears around some of these early hazards in the home and would provide information back to housing teams about the state of people's homes and how they're living. I know we've got Dorset Fire and Rescue, we've got a number of officers who are trained to go in and provide that kind of assessment on an informal basis and provide information back where there are slips or trips or hazards in the homes. But could we formalise this? Could we get more health visitors trained? Could we have more people in the community starting to make a bit of an issue around the quality of people's environments that they're living in? And then respiratory, asthma and COPD, this is where I've picked up the issue around air quality. At the moment, we don't have very active policies to look at smoke control. We tend to follow the statutory guidance around measuring air quality, and where there are exceedances, then you've got to put in control measures. But it's not the same as having a really concerted effort in an area to try to provide incentives and disincentives to improve air quality, particularly really, really small particles, PM 2.5. Those are the ones that have been linked with cardiovascular disease. The evidence is getting stronger and stronger. So then I started to sort of think about what would the role of the ICP or the IPC be? If we're going to have a push on warmer homes, there is information collected on energy performance certificates, and it's been used quite successfully to show the distribution of houses that are more insulated and are better quality across the population. And the news isn't great for our older population. If you look at the distribution of homes with a lower EPC rating, that's much more likely to be among our older population. We collect information on the proportion of the population who experience fuel poverty, modelling around that, particularly when the cost of living crisis started to hit. And Dorset Council had a great information resource starting to model the parts of the population that were going to be most at risk of being unable to heat or afford to heat their homes properly. We have a joint scheme in Dorset and BCP Council called Healthy Homes, and that has been effective at sourcing some national grants. We work with an organisation called Ridgeway, who then identify homes that would qualify for insulation and heating improvements. But again, I come back to this issue of scale. That's our biggest challenge. On all of the kind of estimates, we reckon there might be 40,000 households across Dorset and BCP Council who are in fuel poverty. And Healthy Homes, which is a very good scheme, managed around about 400 measures, give or take a few, in the last 3 years that it was running. That's an average for each of those years. So you can see we've got a scale issue. We're going to do something around some of these issues. I've lifted this shamelessly from a very, very good report from BCP Council, which was looking at ageing. And this just shows the, as I was talking before, the kind of distribution, if you like, about homes that are meeting that decent home standard across the population. You can see if you're over the age of 66, you're far more likely to be living in a home that's more leaky in energy terms, harder to heat, might not even have any energy performance certification at all. So we've got a real problem with some of the stock. This is a chart that always shocks me. It's from the English Housing Conditions Survey, and it basically just shows that across all of those different modes of tenure, private renters with children are the group that are most likely to be living in a damp home. Why does this matter? Well, there's much, much more interest now in the contribution of black mould and other indoor sources that do exacerbate and cause asthma, particularly in children. Andrew sent me a magazine article last night which highlights a film which is only about 15 minutes long. It's called Mould is Political, and if you haven't seen it, I'd really urge you to watch it. It follows the experiences of a doctor in South Yorkshire who's working in a hospital. He's a paediatrician. It just describes the experience of the pattern that he sees, looking at children who are coming in with asthma and then collecting more information about, well, where do you live and what's the state of your home? And again, the story comes through. It's damp, it's mouldy. So it's only 15 minutes. Watch it if you don't know the issues already. I think it's very, very powerful. So I'm just going to finish with some work that is happening locally. There's a very small scale example I'm going to talk about, which is public health working with Dorset Council and a primary care network in Weymouth and Portland to identify families who are living with respiratory conditions. I think the cohort that they're interested in is people who've had 2 exacerbations of asthma in the past year. And the practice is being encouraged to send out hygrometers that can measure obviously the moisture content indoors and information packs to the homes. And above all, they'll make a referral to Ridgeway, who are the Healthy Homes provider. And if the home's appropriate, they will source support to get that home better insulated or better heated to try to resolve that damp problem. But our challenge is capacity. the practices really want to do this work. They really believe in it. They recognise how important this is as a holistic issue if we're going to make inroads into some of these medical conditions, but they just can't find the necessary capacity to do this quickly and to do it at scale. So there is going to be another promotion again in the autumn. We're going back around that to try to encourage greater take-up. But imagine what we could do if we really threw resources in a coordinated way and had a real effort to contribute resource to this as an integrated care partnership and supported some of these priorities. So just very quickly, that NHS focus on the 3 pathways risks missing the bigger picture. The bigger picture isn't easy. It takes time. These are long-term issues. Without a long-term focus and without embedding this in our strategy and work plans, we're just kind of fiddling around the edges, I feel. So I would propose that bringing this into the light a bit would provide a bit more purpose for that question. What is the added value? What's the benefit of the integrated care partnership? And it's a good way that we can join up and support the work that the ICP is doing, recognising the contribution that wider determinants make. We don't really measure or share information on some of these issues. They probably come to different performance boards in different parts of our system. But could we have a conversation about, are there some key indicators that we want to measure and start to track? And even better if we can track progress in improving some of those measures. And I think now is the time to explore links to other plans and strategies in our system. Got a new corporate plan being developed in Dorset Council. BCP Council have just developed their strategic vision and their new corporate plan. And we've got 2 health and wellbeing boards which are due a strategy refresh. So again, it comes back to that theme of where do we put our effort and how would we, I guess, start to pick this up in a forward-looking work plan. So I think that's all I wanted to say. Happy to take questions.
I've got Patricia and then Zoe. And then Paul.
So there was never, just so we're clear, there was never an intention that the 3 priorities in the joint forward plan would all ever purely be an NHS focus. And I think that's why we asked for the work to be done here around where the wider determinants would contribute to that. I think this work is actually, it's the bread and butter of the integrated neighbourhood teams. So I think one of the things that we could do around understanding impact and where we need to focus actually, Sab, is connecting you with Katrina from NAPC, who's launching those first few teams, particularly in Weymouth and Portland, to make sure we've got the right infrastructure and capacity for them to work on the wider issues that we've talked about, not just purely health issues. I think the other conversation that we probably need to have is about place, because what doesn't fit in the INT to me does fit in the wider conversation around place and what is place doing. And so getting those place leadership teams up and running is becoming ever more important now, because some of this wider determinant work that doesn't sit with the INTs absolutely does sit with place. And so I would just really encourage colleagues to really lean into getting those leadership teams set up properly, making sure from a local authority perspective we absolutely have got place lead for each of our 2 local authorities, and the decision making process that we agreed through PwC is established so that some of these issues can be taken forward. Okay.
I've got Zoe and then Paul who want to come in. Zoe. And
thank you. First of all, apologies that I couldn't make it in person today. Just a couple of things going back. I mean, I totally, working backwards, Patricia, with your fit with place, I totally agree with that. And part of yours, Sam, with talking about social mobility and income, etc. And again, I know I sit here at all these meetings and sort of bang on about the third sector and the charity sector where we are sitting in this. The biggest issue I find from our side as well, which will support everything that the councils are doing, is obviously the Section 21s. Now we'll see where that goes with the new government. However, the biggest issue from our side of things is that they might have all this damp, they might have everything else, but the amount, even if you go in and say, right, we can do this, we can do that, and specifically we find with private landlords is that, you know, they are scared, renters are scared to death of actually saying anything. And, you know, I could give you a classic example of yesterday, something similar, and you know, were given a week's notice because they'd complained about damp, and they were literally on the streets last night from 12 o'clock because they're scared to do anything. And when they do get in the system, and again, I know we talked about this all the time, is that they know where they can go and what they can do, and it's the preventative stuff. Similarly, that's the same with people coming out of hospital. What is this care package going to be? That is one part of it. If they're going back to a home where they might have been in hospital some time, haven't been able to pay their rent and all that sort of thing. So it's again, it's us working together with you. And I know we do, but it's often thought of as the last sort of on the list. So all I would plead is that we can be involved in some of these the situations and how you're actually going to pull this together.
Thanks, Zoe. Paul, and then Simon, and then Leslie.
Yeah. So thank you, Sam. I think the graphics are really helpful, and I think the problem is, I guess, you look at those and there's a huge amount that we can do, but so there's a challenge here about where do we put the focus, and partly you can put the focus if you look at place or at neighbourhood level, and you can, as long as they have the information in front of them, they may have different areas to prioritise than other areas depending on what the contributors are to, you take it as these three, but actually it'll impact virtually every health condition that people go on to develop, particularly those long-term conditions. So I think one of the key pieces that has to come from this, if we take this bit seriously, is how do we assess the relative contribution of each of these to our community, however you cut that community, and then that should then help drive where do we put the energy and emphasis where we're going to have the greatest impact. So and some of these will be really hard to measure, but whatever we can do or whatever is already there within our understanding can help us hone down some of these priorities, and maybe that's one of the roles that we can have as a collective, is making sure that we've got that understanding and making sure that those teams we're trying to empower at neighbourhood level have got that, and we're supporting them in targeting the things that make the biggest impact.
Absolutely. Again, this all goes to the need for system working. I mean, you know, everybody's picking up the bits from their perspectives, and it is how do we make sure that we do it as a system, if it is at place, if it is with the neighbourhood teams, if it is with the voluntary sector, if it is with others. Simone, and then Leslie, and then Matt.
Thank you, Sam. I think that was a really clear presentation. I do love the slides. I suppose it's about joining up the dots, isn't it? Because we're all having these conversations, and we had a conversation this morning about expressions of interest for the next sort of neighbourhood team projects, and actually how do we bring this into the vision of the people on the ground. And I'm thinking, you know, we're looking at data packs, and I'm not sure whether DICE can pull out some of this information that can then inform, you know, neighbourhoods when they're expressing interest to sort of develop that neighbourhood working, because it's moving away from, this isn't just about health, this is the whole wider spectrum, isn't it? So I guess my question is, what's your thinking around how we push this under the noses of those developing neighbourhood teams, and is there a process for doing that? Is this something that we can do through the steering group and the programme board, and utilising the data through DICE and the JSNA to give those neighbourhoods sort of information about where they may want to direct their resources?
And I think that's why, again, we've got Matthew and others in the room who hopefully, again, that part of the conversation is how do we link in better? How do we use our data better? If we're focusing on these three areas, which I think we're all saying, these are the areas that we want to focus on, how do we actually make sure that we can get to that scale that you talk about, whether it is using more of the voluntary sector, whether it is making sure we're aligned with the neighbourhood teams, whether it is making sure that Place does their part. I think that's the key element here. I've got Leslie.
Yeah, thanks, Cecilia. Nice to see everyone. I mean, I'm just to sort of endorse really what Patricia was saying about the neighbourhood teams. Sitting in Boscombe, there's been a real energy around neighbourhood, and that's partly because there's the Towns Fund. So there is a vehicle already there, and other things, whether it was BCP Future Place, I put in the chat around, there's a lot of work that was done in some of these key areas within BCP, driven by the Future Places and charrettes, and it involved, the well-being and the house, and everyone was brought together, and actually we had half days and we made notes and we had plans, and actually the housing fed into the well-being of the community and the green spaces and looking at the health centres. So I sort of feel like we've almost taken a step back. Because we were looking at wellbeing hubs, and then that sort of disappeared, and I don't think the neighbourhood work has kind of quite picked up. But at least there there's a sort of funded vehicle that's bringing people together and maintaining momentum. And I guess this is what Simone was coming to. We've got various data sets and data points and individuals that are interested, but it's where the admin support, where the vehicle is that people can sit around and really drive it, I guess is I guess the key around the areas that are moving forward. And I think actually in Boscombe we do have that. It would be quite easy to bring health more to the forefront. It started as a very arts-based development, and I think health is really sitting at the forefront with the new community centre that's coming in. It's been funded, and that was a change in the planning. So I think that's kind of set. So I think it's hard to know, as you say, there's not one thing that's necessarily going to drive it, but it feels like that infrastructure to make sure that things are shifting, which I guess is sitting with ICB through neighbourhood health and wellbeing boards through the neighbourhood side, but it does feel like a momentum issue locally a bit, if I'm honest.
Thank you. I'm going to take Matthew, David, and Jenny, and then come back to.
So thank you. So this is a really important subject matter, and of course, much of what we're talking about here are the big determinants of health that have been spoken about since the dawn of the NHS and before. And we know that in terms of health outcomes, Sam, you'll have a better figure than me, but it's about an 80-20 split in terms of 80% of your health outcomes are determined by these big determinants. So, and I think what we've got here under these headings is actually a set of different things. So we've got some things which are about a philosophy of care, make every contact count. Some things which are about a more technical model of care. What's your model for frailty? How do you move that to an anticipatory care model? And then really importantly, some things which are genuinely about the determinants of health. So the things to do with the housing stock, the relationship with private renters, the points about air quality and pollution. And I think, actually, I think I take a different view probably to the majority of views in the conversation. So I don't think that the integrated neighbourhood team programme will address these things. I do think that the place agenda will and should. So I think within how the ICP works and how the wider integrated care system works, I think it's really important that we have some role clarity here. And I suppose some of my questions would be on the bigger determinants of health, which is the majority of the things that you're identifying. What is the relationship with the local authority? What levers have the local authority got that they can pull? It isn't, in my view, it's not up to tenants in private housing stock to go in with a damp meter and then have the conversation with their landlords. I think that's only going to go one way, and the way that we've heard, it's actually about how we regulate some of that, what the relationship is with the private rental market. So the integrated neighbourhood teams, which we will hear more from later, can play a role, but they are not the vehicle that's going to address all of this. I think the place-based partnerships could, and therefore there's a conversation about where they are, how they're working, how they need to develop.
I think that's very helpful, Matthew, because actually, again, there is some confusion as what place-based partnerships and INTs, are they the same, are they different? And I think you've actually started to really clarify where they're different. I think you know exactly what they are, but I think there is still some clearly confusion as to where those edges are and where people act.
To be honest, I think where Matthew's coming from, which is where I agree, INTs are not the solution, but they quite often will be the signpost into other parts of the system that need to resolve some of the issues that we're talking about. I think there is a small element of what is in this slide pack that can be addressed by the integrated neighbourhood teams, but the majority of it, when we think about what a lot of our PCNs are using some of the R's rules for as an example, will be signposting people to where to get the right support within the place infrastructure. What I would really like to see as an outcome of this conversation is we are really clear what are the small elements that sit with INT, but also that we ask both of our local authority colleagues, partners, to come back to the next ICP with the place leadership teams established, and we've got a work programme of priorities that we're all signed up to. Because it feels like we've been having that conversation for such a long time and we're not making progress on it. And in response to Leslie's question about pace, in terms of the integrated neighbourhood teams, there is a plan, but it is a plan over a year to set up all of the, I think we've got 20 in the thinking at the moment. So we won't have them all set up yet. There won't be the pace underneath them all because it's an incremental process to get them all set up by the end of March next year.
Yeah, absolutely. Take final comment from David.
Yeah, thanks. I'll keep it brief. Thank you, Sam, for the report. As always, I really like the sort of focus. The graphics are very, very useful, very informative. And I think, like Matthew said, it's like I sat in a meeting here some months ago and I remember somebody saying, none of this is new. We're not thinking, it's not thinking outside the box. It's about food and nutrition. It's about decent homes. It's about stopping smoking. It's about helping lifestyles. It's stuff we've always known are the right things to do, and that's sort of really focused on these are the things that we need to be doing because we know they're the right things to do, and they will have an impact on outcomes. And I've sat in meetings for years and years as a councillor, looking at these sorts of things and thinking, well, do they actually have the right outcome? And completely unrelated, but the BCP Council got a youth justice plan tonight on our council agenda. And there's a really statistically significant drop in the number of young people that are entering the youth justice system. And you think, I've seen these reports coming out annually for years, and we know we're doing the right things. And I looked at those figures and I thought, we've known for years we're doing the right things, and it looks like we were, because they've really statistically dropped. And I'm hoping, I'm more confident that actually, if we do all these right things and we measure them, for me, those conclusions about we don't currently share the information and measure, we need to be measuring them. Those measures will show in 3, 4, 5 years' time. So we'll be sitting there looking, oh, this is statistically significant. There's been a big drop here and there. And I think sometimes we do just need to think, we know what the right things are. Evidence and research has shown it for years. We just need to, we know it will have been improved outcomes. So yeah, let's really sort of focus on these areas and push ahead with them. So thank you for, again, a sort of reasonably brief report, but cutting to the chase and telling us what we all know.
So we're getting a bit short on time for the next two papers. So Sam, I think you've got a full endorsement that we're in the right place. That the way this is presented, focusing on the data, on the positivity, on the measures is good. The challenge around scale, I think we can hear where partners can play into that. I think we do need to understand how we can take that next bit forward, but I don't expect you to be able to tell us that now. But I think partners need to be thinking about their work. Is that the challenge that you placed to us?
Can I summarise very quickly? So I think what I've heard is it would be helpful to start to focus through the joint strategic needs assessment, perhaps a bit more specifically on some of the links between housing and health, and we'll start to collect some of those indicators and share them more regularly. I heard Zoe's point very clearly, really. I think, there's a policy issue here, isn't there? On one level, you're seeing individuals who are fearful about the impact on their tenancy when they're raising these issues. But what's our role as a local system in trying to understand where that's happening, why it's happening, and what are the levers that we do have to be able to use at scale to do something differently? I'd be interested to see what comes out of government, but that shouldn't be an excuse. You know, I think there are probably things we could do locally to put a bit more pressure when that's not right. And then I definitely recognise that tension between what happens at neighbourhood team level versus what should be going into a work programme in each of the places. Perhaps just at neighbourhood team level, it's a simple question. The people working in those teams know what the next step to take is. If someone comes in and says, actually, I think this might be linked with my housing. And it's just that simple join up sometimes can help. But that's not going to be at scale. And that's why I think some of these issues do need to be asked of the place work programme, for want of a better word. What is it that we might be able to do at scale to push on some of these issues? Does that roughly cover it?
Yeah, I think so, absolutely. Thank you. Thanks very much.
Thank you. Really helpful.
So now we've got 2 more papers here. Now, I think David has asked if he can go before you, Nicola. Is that okay? Okay. I'm sorry. I think David. The note I have is that you're off on holiday.
No, not quite as exciting as that. No, I'm booked some leave this afternoon. It's been in the diary for a couple of months. I'm actually going to a wedding. But it's to a Muslim wedding, would you believe? It's first time I've ever been to a Muslim wedding. I'm really excited about it. So apologies that I can't be there. And I do need to leave shortly, which is why we've negotiated and agreed to have this swap. So I hope of this agenda item. So I hope that's okay. Shall I make a start, Cecilia? Is that all right?
Yes, please do. As I say, I think we've probably got about 15 minutes for this, if that's okay. Yeah.
Yeah, sure. I mean, it's a relatively short paper anyway. So I guess the key thing to get across first and foremost is that when we discussed this social mobility back in February at the ICP in February, we were still quite early in our thinking, and we were starting to explore and sort of recognising we needed to understand a little bit more about what was going on in terms of social mobility across the whole of Dorset. In between February and this paper coming back here, conversations have developed. Our focus and purpose of the ICP has evolved, and clearly from the last meeting and obviously the purpose of these clutch of papers here, we're starting to sort of hone in on and zoom in on some key priorities. So there's a slight overlap. I'm doing that as context because there's a slight overlap with what this paper, this paper was intended to demonstrate, and what we now need to do. So there are two parts to this paper. One was a planned update anyway on that work we agreed to initiate back in February. That's led to some recommendations and an update on the nature of those discussions in the paper, which I'd like to consider. And what was becoming apparent through that work was a need to sort of think about how we might go further with our commitment to social mobility. And it's already sort of reached the point that it is a kind of top area of priority for the ICP. But the recommendation in the paper goes a step further about sort of saying there ought to be, we feel that we would benefit from a galvanizing force behind that. So for not wanting to explain the whole of the paper, because I'm hoping you've had a chance to read it, there are a couple of things that I do want to highlight. One, because one of the things we identified was the importance of data, and that takes a little bit more work to do to pull that together. When going through the work and getting this paper together, I did come across there's quite a lot of data out there, but it's a little bit sort of disjointed. I put 3 examples in there, one from the Southwest Social Mobility Commission, one element from BCP and one element from Dorset Council, with the deliberate intention of demonstrating sort of 3 data points. One is around education, one is around employment, and the other around deprivation. It's not saying that the data isn't available in all the areas. I just wanted to show that all the different areas play into or give us strong indications about what plays into social mobility, and gives us strong indications about the gaps and the issues that we have to wrestle with across Dorset. I think it also, the key thing I wanted to make, a point I wanted to make here is the critical importance of this work and the potential value and the interconnectedness of everything. So we've heard already about housing, about the wider determinants of health. We'll hear in a few moments around employment, and you can see the connectedness. And it is possible that if we pay strong attention to each of those three areas, we will de facto start to impact social mobility, because we will be trying to do things earlier in the life cycle, earlier in the pathway, to give people better choices, better opportunities. I think what we want to try and get across through our social mobility work here, and what we've identified, is actually there is a real opportunity and a real need to galvanise some action in this space, to really use this thread of work to instill sort of hope, optimism, aspiration, and to really sell the opportunities that are already there for people in our Dorset-wide communities. So we've landed on three key areas. One is to sort of pull together a workshop to consider whether there's value in running an umbrella campaign, and we point to the London example within the document. And interestingly, certainly one of the data points we're using there is about London being one of the best performing regions on a number of indicators of social mobility, and they've been running a campaign for a little while, which is an umbrella campaign, and inviting employers, businesses, education sector, public sector to come together and make some commitments to the local population to give them opportunities to access new things, new ideas, and to instill in them the hope and optimism that galvanises social mobility. We thought there might be value in pursuing something like that for Dorset, because there's already a huge amount of work going on, and we didn't want to duplicate or cut across any of that work, but sort of bring it together. And building on that, actually, when we were sharing in our little task and finish group, we didn't know what each of the other partners were doing. So we weren't making the best of the possible connections between our different partners. So another recommendation would be to bring together a conference where we can showcase some of that work, bring in some external ideas, and generate and energize some different ideas and ways of working to the benefit of our Dorset population. So that was kind of the product of our original work, and as I said, in the meantime, we've further elevated this to become a top priority for us pan Dorset for the ICP. And building on that, there is a recommendation in there that this would benefit from somebody working to try and galvanise that action, to bring the partners together, to champion this, and to be a support for those partners, as well as a support for the ICP in making sure this work sort of accelerates and expands, and more people access more opportunities more of the time. So I think that's kind of where I wanted to go. So I kind of inviting comment, check and challenge, and possibly support for those ideas and recommendations, but just to really sort of hopefully show the work we've been doing and sort of stimulate a good conversation across members.
Thanks, David. Can you remind us who are members of or who's actually been able to join the task and finish groups so far? Is it?
Well, we've had all partners. We've had colleagues from education sector, employment. We've had the Health Innovation Wessex. We've had local authorities and ourselves. So and voluntary sector as well. So we had a good sort of diagonal slice of all our different partners. It wasn't a full 360. There weren't all partners representing all things, but we did have good sort of input to it.
Anyone want to come in, please?
Hi, David. I'm Alice Deacon. I'm the Corporate Director for Commissioning and Partnerships in Children's. And really recently at Health and Wellbeing Board, we brought a paper around social mobility and agreed some actions headed up by Sarah Crabb in terms of bringing that together. And it'd be a really timely moment for us to come together. We're taking social mobility to Cabinet early September. And we've got good support across Directorate in terms of local authority, bringing that really well together. And we've done lots of work to try and think about those kind of key influencing factors and how we can mobilise across. So I think opportunity knocks to get closer together and really drive up what we're doing as a partnership across. So very keen to be involved and be part of what you're doing, so we can.
It's got that clear.
Yeah, great, perfect.
I mean, that is a great opportunity, and certainly, as you will have, all the skills work that we're doing feeds into the enterprise work that's been going on. Feeds into this as well, and a lot of other activities. So I guess it's trying to see where the edges of this map are and who else we might be able to feed into this system. So a conference would certainly be a way of exposing those and getting everyone together to identify what they can do. Patricia.
I suppose there's a bit of I suppose it's an elephant in the room, if you like, for me, that it's about the economy and understanding what local government or the LEP or Dorset Chambers are doing in that space, because we can do as much as we are able in terms of making sure that the workforce is fit for purpose, but if the opportunities aren't there in the economy, then they will leave.
Well, hopefully, again, we have tried to represent that. We've put out a strategy from the LEP. We've worked with the local authorities. They're on the LEP board. We have we have regular labour market statistics and job opportunities identified. We know that we have more jobs than we have people to do those jobs, and many of those, at least 50% of those, are good paying jobs. They're not just not what one might consider as just a living wage role. So there are significant opportunities. The challenge comes back round from those is that actually the employers can't recruit because they're losing people to other places where people can afford to live. So we end up in this constant cycle. Yeah. So I think we have opportunities in Dorset. We can talk to the skills work that we do in order to be able to provide those opportunities. I think there is a plan. I think I did share with you if anyone else would like to have a look at the local strategy as well. I mean, that we're looking for any more comments on that business strategy. But the opportunities are there, including Great Southwest and other areas. For me, the opportunities are there. The challenge is how do you actually employ people that can afford to live here? We have employers who came to our conference and saying they'd actually invested in apprentices, they'd invested in putting people through training, only to lose them when they were looking for homes later on to bring up their families. Those people left.
That's my point, and I'm not expecting you to answer it as the chair, but I do think we need to think as partnership. There are three core things, aren't there, that come together to provide social mobility. There is the economy being fit for purpose for the right kind of roles. There's us making sure that young people are able to access those roles because they're appropriately trained, but there's also the fact that they need affordable housing in order to stay. And if we're not connecting those three things together at the right stages, then we could end up doing a lot of work that's not going to lead us anywhere.
I agree, and I think that's the plan. Is how do we do that? How do we make that work? This social mobility work will help flesh out some aspects of it. That the skills work, I think that Nicola's going to be talking to us, will help flesh out some of the other bit. But if it doesn't link into the housing element of it, you're absolutely right that we're going nowhere.
And there's also it's a broader, deeper conversation we need to get into outside, but we've got to do something with our education system as well, because dependent on where you live, teachers have a huge role in shaping your aspirations. And we know that in areas where there were areas that are more deprived, there's more low wages, that the careers advice and support that young people get in those schools is not good enough. It doesn't raise their aspirations, and we need to tackle that head on. We can't just keep ignoring it because it's a reality. And if you go to somewhere like Portland in here, the careers talk that those young people get compared to what they get at Thomas Hardy, it's light years away, and they're no less capable.
Again, I think we need to expose more of the careers team to this group, because I think we have done some great work across the place in trying to get to individuals who have special educational needs and putting on special career fairs for them, as well as for dealing with other aspects. Nicola may be able to give us some more information about her work in that as well. It is a key area. So I've got Matt and then Steve.
Thank you. So Patricia, I just really wanted to come alongside you and support the points that you're making in relation to this, and that the work looks as if it's progressing significantly. So thank you, David, and those involved. But the points the points that you've just made, I believe are really central, and we could do within this space with seeing some data, because I think that question about educational opportunities and actually educational outcomes is really important. And if you relate that to what's in this report about particularly South Dorset and the measures of social mobility, this isn't just about educational opportunities for people with special needs. It's about educational aspirations across the board for all ranges of ability. And in terms of the labour market, I think there's a real question about what's the nature of the jobs available. So, David, this might be something the group is already picking up, but the data that I've got, which could be out of date, is showing, for example, in the Dorset local authority area, that the average wage is below the national average. So in that context, the issue isn't just about housing; it's about the type of labour market that we've got.
To come in on that, high employment, low wage.
Yes.
Yeah. But even when we say high employment, in places like Weymouth, where it appears as if we have full employment, the reality is a lot of those people on 0 hours contracts. That's not full employment. And so we've got to get underneath some of those things and really understand what's happening. But, when you read comments from some of our head teachers when the national report comes out around children's results, and what we hear are, comments being put into the media and statements, which is, well, this is what you expect in a deprived community. How do we expect to raise the aspirations of our young people, even if we are creating fantastic jobs for them?
Morning, everyone. I've been coughing a little bit this morning. I've got a sinus problem. It's not COVID. I checked regularly. Just and apologise for my cough. I think the paper is obviously excellent, and we'd all back it. One observation that I would make is that by investing in developing opportunities for younger people, we're trying to solve a long-term problem, when actually there are also some short and medium-term problems by investing in the current workforce and providing opportunities for people in mid and later life who might want to reskill due to ill health or changing circumstances. They're no longer able to continue doing the job that they might have chosen from school. And there's also the recognition that many young people leaving school haven't got a clue what they want to do, would not dream of a career in the civil service until later life, and they find out how exciting it is. So it's about finding opportunities along the life course for people to find skills that are appropriate to where they are, and that by implication will also then have a shorter term impact on the economy.
Lifelong learning, absolutely. It's a great segue, I think, into the next presentation. David, thank you very much. Did you? I think your recommendations for certainly for a conference, I think will get the support of the group here. What was your other ask? You were looking at a workshop.
Yeah, so we will design the workshop, and the workshop itself will come out with recommendations. It feels like a really strong idea to do an umbrella campaign. We'll do the workshop and involve the right people with lived experience, all the rest of it. We think it's it, but we want to test it, and if it's a good idea, we'll build it, and then that becomes a recommendation. So we'll come back on that. The other part was, I'll take my hand down, around somebody to lead it. Now, I wanted to see, I was deliberately not putting my name forward in the paper because I wanted to see where the conversation went. But actually, I'm really, really keen to sponsor this work. There's the way we're working in the ICB, it's emerging as one of my priorities. So I'll be doing some work on this for the health side. But I would be very keen to support this through the system across the partnership. Bearing in mind, the original intent of the work was to bring partners together to see if we could do a little bit more. I think to Matthew's point, what's emerged is actually we can do more because we can go deeper to understand the causes, what the data's telling us, and some of the interconnectedness. And Alice, to your point, I did read the paper and I quoted the stats from the paper just to illustrate that there's connectedness starting to be made all over the place. So, I'd like to volunteer to do it, and I will be doing it with two hats. One is on behalf of the ICB doing the work that we need to do, and then here for the system partners. It's not just NHS-led work, it's a partnership work. And I feel I'm like a job interview, I feel really comfortable that I could manage the two hats. And as you might tell, I'm really, really passionate about this. I think there's great opportunity. We can do some immediate things, which are the first two recommendations, which I think will make a big impact. But we need to see the real opportunity to go further, and help all our organisations do more. And I think that will give us some short-term, medium-term, and obviously long-term gains as we build it. So if people, so I'm going to put that forward into this meeting for, you might want to push back on that, but I'm volunteering, I guess.
I'm not seeing anyone here looking to fight you for it, David. And your boss is here as well, and she's not indicated that there's any issues with it. We do need someone to lead it, to shape it. I think if we can take it through to the next workshop, if there's any issues that need to be taken outside this meeting, they should be. But otherwise, I would fully endorse your activity, your passion. It comes through, and your drive to make this happen is something that we need in order to be able to make this work for the people of Dorset. So I fully endorse it. Anyone else want to have any further words on this?
Only that I don't want us to lose the two issues that Matthew raised around understanding the baseline data and what it's telling us really, and how do we make sure we build that connection at the right level and pace between employment opportunities, economic growth, and housing.
And it sounds like it is another multi-headed hydra, isn't it? It's got to have all of those pieces in there and represented well, such that we can actually deliver on it.
On that here, there's a real key thing, and I've not been to these meetings before, but everything that I'm hearing makes me really desperate to get hold of that data. And it's about developing understanding, isn't it? There's an awful lot here and a huge range of different issues, really critical and absolutely aligned to what the partnership's objectives are. We need to make sure that we've got the right data and that understanding of what's happening. I could give you examples of work that we're doing with the Royal Foundation in BCP, which is about homelessness, but actually it is about social mobility as well. And I just think there's something about mapping the data, really making sure that we have good analysis to support, multi-agency data sharing that really supports good, strong conclusions. But part of that has to be about mapping out what's happening. And it feels like we need that work to then inform some of the work here, which I'm sure goes without saying. It just shouts out to me that that's absolutely what's needed.
And it's great to have you in the room listening to that and picking that up. So that's fantastic.
You're giving that to me to resolve.
Well, I think you're part of the solution. Absolutely.
Yeah.
Absolutely.
But we need some resource to power that, and that's a partnership conversation that I think we need to have.
Yeah. Agree. Leslie, can we have one final comment from you?
Yeah, just to really support what David's doing, and I know that obviously across the skills board, which I also sit on, as you know, Cecilia, and the work that's kind of coming through, the data is very full, and the number of projects around trying to raise aspiration, driving things through, whether it's the Southern Universities network, right, working with schools right through, something like 139 schools involved. It's not for the lack of effort, but I think there's something, how we break through, I think is really important. And that's why I think it comes back to, as we've said, the broader perspective. I've just read some stats sort of saying that of the applicants to universities this year, 36% of them have had time off through mental health problems at school, which is so the sort of, students that are coming through, and these are the ones that probably are the people aspiring really well. And high achievers, but a third of those have been off through mental health. So there's a real issue, and we see this coming through schools, we see it coming through colleges, of actually, there are all sorts of other issues around this environment which are holding people back. I think it's tackling those deeper issues, and we can only do that together by looking at the stats. I agree. So really support David. Thank you so much.
Thank you. And I think I definitely need to move on to the next paper. Otherwise, we're running behind time. So enjoy the wedding. Nicola, I'm sorry to have bumped you around there.
And so, yes, how long have I got?
Yourself? Give yourself 15 minutes.
Okay, that's fine. So, Nicola Newman, for those of you who've not come across me before, just sort of going a little bit further back, given the previous conversation, I used to be Chief Executive of Ansbury Guidance, which was the career service in Dorset, which closed in 21. As part of that, I was a member of the chamber, and then subsequently worked with the chamber to bid for and now lead the local skills improvement project, which is the Department of Education funded project. 3 years ending in March this year. A lot of the work will be wrapped up into the New Skills England. Exactly how that will work, we don't know. But the basis of this is an employer-led perspective of skills needs in Dorset. And the issues that have been raised, I'm not going to talk through all the slides because you've got them. I'm going to talk about some of the key points. The issues that have been raised are about two key things: the capacity of the workforce, which is what we've been talking about today, and I think it was the capacity of the workforce that I wanted to bring to this group primarily, although there is information for you around the capability and the specific skills. So the DfE wanted us to work with local employers. They wanted us to be very specific about the sectors that we focused in on. They wanted us to work with other bodies that were already operating, like the Local Enterprise Partnership, like the Skills Board, with all of the providers in this space, and that's what we've done. And we'll reference Leslie and her organisation as being particularly helpful as well. So thank you, Leslie. So that's sort of a bit of my background. Currently, I'm also chair of the LET Skills Board as a LET board member. And I've also been the board member of Kingston Morwood College. You may know it's going to merge with Weymouth College from the 1st of August. So I will be a board member of the new college as well. So that's quite good from a sort of consistency point of view. So the Local Skills Improvement Plan is published. I think a lot of the information that some of you are seeking is in it. There's a lot of data that we managed to bring together around a whole bunch of stuff that's in that plan that you can go to. The technical education piece, just to sort of highlight, that is about where education is aligning with specific roles and occupations. So that was where, again, we were asked to focus. There was 4 of the local providers who had a particular role to play, which at the time was the 3 colleges, will be the 2 colleges in the future, and the adult skills and learning provision, because all of them had a new responsibility, which was to do an annual accountability statement. They now have to say on an annual basis how their provision meets the local needs identified in the Local Skills Improvement Plan, which is quite a big ask of them. And that's also something that Ofsted now looks at for those 4 organisations. So they will have an enhanced inspection supposed to be between now and the end of March, which will look at how closely they are engaging with the employers and how closely they're providing provision, and all of that is quite new. Not all welcome, if I'm honest, but new. It was new, so we're now in a new government, in a new place. Anything else could happen, we're not sure. So just highlighted again some of the objectives of the project, which are all there for you, the sorts of organisations that we've been working with. The sectors, I'll just briefly identify the sectors. So these were identified through the Skills Board and through the partnership as being not just the biggest employers in the area, but those that were in most need or growing rapidly or changing rapidly. So healthcare and social care, advanced manufacturing and engineering, construction, digital tech and creative, agriculture, aquaculture and agri-tech were the 5 employment sectors that we looked at specifically. We were asked by the government to look at net zero, and then we chose to also look at how digital skills were working and leadership and management were working. All of that is evidenced in the plan that was published in August. What came out of that, which isn't news to any of you, is that health is the biggest employer in the area. The public sector in total is the biggest employer. But also that when we were talking to employers themselves, most of whom are very small, as you know, also vast majority have got 10 or less. So we're talking micro, not just small. They were always talking about the individuals not being available to them to train, or not having the confidence in the workforce to join the workforce or be trained. Or so there was a lot of discussion really early on about some of the capacity issues, and also people leaving earlier, retiring earlier, etc. So we have looked very closely at what we could be doing with employers to build capacity and to encourage them to take on more people with different backgrounds, different ranges of skills, and not expect somebody to walk through the door that is exactly who they've advertised for. they were not all aware that we had a shrinking workforce. They were not all aware that we had an ageing population. They were not all aware that people leaving the area because of housing costs. They didn't know that. And in knowing that, then they can alter their own understanding and their own behaviour. So it's very much focused on what employers can do as well. Capability-wise, there's some specifics that we've been asked to look at. The DfE at the time was very keen that we were very granular and that we weren't making sweeping statements about where change was needed, and that's what we have been doing. So we're working very closely with individual curriculum needs in the providers around how we can meet some of the specifics. So yeah, we've been publishing more information as it's become available, more data, working with more people as we get to know who they are, because we started this from a sort of standing start in the chamber. But I think the message for me and for the chamber is that, you know, in order to achieve economic prosperity and social prosperity in Dorset, regardless who the government is, these issues are ours. They're not going to change unless we make them change. So it doesn't really matter who's in government in some ways. These are just issues that need to be highlighted, more people need to be aware of. And obviously within the education system, which just came up in discussion, young people who are, and it isn't just about young people, I will stress that, it is about older workers as well, or people that need to be retrained. But the younger workers were not necessarily always aware of where the opportunities are, not necessarily aware of where they could get the training that's needed. But that's not to say that there isn't a really good careers hub in this area. In fact, Dorset's careers hub is one of the best in the country. And those are the people who are working with schools and guiding schools and how to build their careers education programs. It's all desperately as ever under-resourced. The time within the school system is low for that type of activity as well. So much, you know, there's, I mean, I could go on, there's so much to do. You can see the sorts of things that we're looking to change. And I suppose for this group, I would say at a really high level, it is about what you can do as employers and how you can yourself inspire, support, mentor, train people that may not have thought of working in your environment or may not be the norm for your environment, how you can provide guidance around accommodation or provide accommodation, how you can provide or guide people to transport, childcare, all these things that are going to stop people or are barriers to people working, because ultimately we need more of them for longer, and that will be what Dorset will benefit from.
Thank you. That was a whistle-stop tour, but I hope it gives those who weren't aware that, you know, a picture of what's going on in those local skills improvement plans. Can I ask, did everyone know about local skills improvement plans beforehand, before this? Yeah? So it's generally known. And well, that's good. Your awareness is up there. It is the detail. And much is happening. Yeah. And how this fits in with, I mean, again, hopefully from the conversations you've had, Nicola, you'll see how so much of what you've been doing there fits in. It's how do we feed that in further to make sure that we, not only in the social mobility, but in other aspects, making sure we've got the skills.
Yeah. And actually, I would just make one point actually about events. We've got an event in February, which I think I highlighted on one of the last slides, which is about, it's called a People Festival. It's about celebrating Dorset's working population, and that hopefully all of these things might come together on that day. And we're still working on the agenda and the content. So if anybody's interested in that as well, let me know.
Thank you. Thank you, Nicola. So do we have any questions for Nicola? Any comments? Sam?
I think it's a comment rather than a question, Nicola. I really liked what you said about, you know, the issues are still going to be here, even if there's a different government and a different policy landscape. And I think from what I've heard today from a number of presentations, a theme that's emerging for me, which is that there are some quite big structural levers which we keep coming back to. And I just wonder if we've all become a bit complacent because of the absence of national policy around some of these issues. But if we re-energised our system, what are the most important things and what's within our gift and what's within our scope as large employers or leaders? And could we get them more visible? Could we get them out on the table and have a proper conversation about what we can push on at a local level rather than just kind of, you know, waiting for the cavalry to come?
I think that's a good challenge. I mean, given that such a number of or a big percentage of people who work in this county work for public sector organisations, what can those organisations do about paying conditions to actually, and if they become competitive to other organisations, that's how this works. You end up in that sort of opportunity. For people, if it becomes that job seekers market where they can dictate a better wage, is that something that we can use that lever as anchor institutions in order to develop? I don't know. Okay, well, it's a pivotal part of our work, but I think if we can give ourselves just a 10-minute break now and then come back for those on screen, I think if we can be back by midday, that would be great. Thank you. Thanks very much. Okay. looking at the Dorset Innovation Hub. And again, another key part of our work in terms of championing new technology, new ways of working. And I'm delighted that we've got Sarah Cheswell with us. And Sarah, if you could introduce yourself and take us through. I recognise there's a lot of stuff here and we might have to come back about it, but this is great to have that introduction. So thank you.
10 minutes, 5 minutes?
10 minutes.
10 minutes. So thank you. It's lovely to be able to join you today and to actually be able to hear the papers as well, because it actually does bring into stark reality the wider programmes of work. So my name's Sarah Cheswell. I'm lead for the Dorset Innovation Hub and I'm head of innovation at NHS Dorset. I moved across on the 1st of May. So in your papers, and we're not going to put it up on the screen, but in your papers is a brief overview to start a conversation about the work that we're doing. So we were one of 4 Health Foundation Innovation Adoption Hubs. So we were awarded funding as part of a grant, as part of an experiment to see if a different way of working could work and could have an impact. So for 2.5 years, we had this grant working with the Health Foundation, working with the Innovation Unit to look at an approach where we worked in partnership within Dorset to actually make an impact with innovation. Can everyone hear me, those that are on the screen? Yep, thank you.
Yes, thank you.
Thank you. The grant finished at the end of March and we've now moved hosted as a centralised service within NHS Dorset. So we're within a period of change and we're looking at that review and integration within NHS Dorset, rationalising our priority projects and our work streams and streamlining to just make sure we're working on system approaches in a more cohesive way. So that will be done over the next couple of quarters. I'm starting to have the discussions. On slide 2, you've got an overview of the partners, and within the white ellipse, we've got the key partners within Dorset, and delighted over the last few months to have signed up Dorset Police, who are very actively working with us. But you can see the 3 academic institutions. Now, we work in this golden thread of improvement and have been likened to a mini ICP. And of course, therefore, work closely with and collaboratively with the NIHR ARC Wessex, so the Applied Research Collaboration, the Health Innovation Wessex, fabulous to see Richard here today, and the Wessex Health Partners, as well as the Wessex CRN, so the Comprehensive Research Network. There will be others, of course, but those are the key supporting partners as well. Coming through to slide 3, just briefly giving you an overview, we work with a programme group which are voting members of your organisation. So it's Gillian for BCP Council and it's Mark Tyson when we look at Dorset Council. And so our membership goes on. And it's representation across all those organisations. We're currently looking at the ambulance service as well as fire as well, and possibly RNLI. Programme group oversee the programme of work and mitigation of risks, and really are those conduits when we look at the links, as is being talked about here, with regards to the wider determinants of health. So making sure we're not just health service focused. Lots of ongoing work. So within the 3.5 years we've been working together, we're just becoming interesting. Sorry, I've got my back to you, Cecilia.
No. We're
just becoming interesting in the fact of actually making an impact, understanding what one another are working on. So this innovation, this experiment working together has been fascinating and continues to be a privilege to work and learn with everyone. The core team, as you can see on slide 3, are really the practical project managers that are taking forward, and we work with benefit in kind. So we work together, gifting time to one another. Yesterday, the privilege to work out of Bournemouth University, to be speaking to the faculty coordinators and looking at opportunities to take forward work that actually focuses on needs. And that's the absolute key for us, is we focus on what the need is against the priorities within the 5-year forward plan, and very much picking up on what Sam was talking about, looking at those wider determinants of health. As part of the work streams, we also have the strategy with regards to governance that dovetails into NHS Dorset governance and thinking about those universal languages. So we're not just that health focus and very much facilitating. So we don't helicopter in and do to folk. We work with you for your organisations on priorities and with the clinical and operational teams to make sure that actually we've got an element of sustainability, so that when we move from a project to business as usual, it has that ability to sustain where appropriate. On slide 4, there's a very interesting wheel that we've been testing with the innovation unit and has now been formally published. So we've been using this for about 3 years, and it's all about creating this authorising environment with a focus, of course, on adoption of innovation projects, but you could put it across the board when we look at any of the work that we do. Building those capabilities and nurturing the cultures. So we score ourselves in our development sessions. Twice a year we have face-to-face development sessions, and it's about how the programme group, their strategic level, and then the core team at their practical level, how they feel we have processes in place to support each of the elements. So the stars, you can see that we want to further work on evaluation and learning. The educational offers is a priority for us again. The adoption approaches and linking in with Richard and the wider team, Leah, etc. And then the partnerships, as I say, bringing on board more partners, so we've got those wider voices. And then you can see nurturing environments. It's very much about creating a culture where we can work together. We remove barriers so that we have this ability to take forward priority projects. Again, I'm talking from an innovation focus, but you could argue that this could go across education, skills and wider. On slide 5, and as Cecilia said, this is just an opportunity to provide an overview because I could quite happily talk for a couple of hours on these slides, but I won't, I promise. But on slide 5, we've got the learning about effective adoption. So these are a certain number of slides that have been taken from our end of grant report. We've moved to business as usual. And what is the learning from what we've done to date? So within this 3.5 years. So the daisy wheel on the right is the Health Foundation's response to CQC, the Care Quality Commission. So we've been working for the last 3.5 years with our partners with what we call developing the impact. And each organisation at our meetings provides an update on what impact they're creating via innovation. So, for example, I was speaking yesterday to Gillian Kay about the update she'll be providing in September to the programme group. What is BCP doing with regards to innovation taking approaches, looking at the new adult social care and the programmes of work, looking at benefit realisation? Dovetails in seeing Leslie on the screen from an AECC perspective. What is the AECC doing? So each organisation being responsible for their developing the impact and feeding that in. But the vision is with actually a focus on the CQC requirements. So we are thinking from a developmental perspective, from a CQC perspective, so Care Quality Commission. Looking at that golden thread of quality, then thinking about we are complex systems within complex systems and recognising that organisations are at different stages of their development. Can you give me a 2-minute nod, Cecilia? Would that be all right? Is that all right? Yeah. So thinking about and understanding where organisations are and thinking about how actually we can support with that development of that cultural piece, thinking about our education programme, which we run with the AECC, and how we can actually get the right skills and capability in place to be able to create impact. Nurturing connectivity is really important, so creating those relationships, having those discussions, understanding where folk are and legitimising where there could be further development. But being very British, I don't think we celebrate as well what we're doing well. So at the recent Dorset Innovation Hub Summit in the middle of June, we're able to showcase some 38 improvement posters that really showed what work is happening within Dorset. And that's just a small snip of what we call visualising innovation. So nurturing those connectivities and those relationships, understanding the needs, so really doing less projects and doing them well, project management, thinking about actually is there a real need for a project We've heard a lot about data driven. We use DICE, so looking at geo-mapping an area of need, nutrition in aging people, for example, or we're working on fractional exhaled nitric oxide, which is diagnosis for asthma, so links in with what Sam was saying earlier, and actually understanding where the areas of need are and being able to come in, facilitate and support that. So really good project management, taking system approaches, pulling the teams together to work together. Baselining, so understanding what the current need is, but also to be able to look then at benefits realisation. Have we made an impact? Is it positive? And if it's not positive, we actually have to look at stopping. We actually need to make that brave decision and stop. And then I'll very quickly finish. So thinking about slide 5 at the bottom, thinking about capabilities and enabling, empowering people so that actually we can take forward. One more minute or finish round up?
No, I was thinking your key priorities is a good one to have a look at for this year, I think, which is your slide 10.
So slide 10, thinking about, as I said earlier in speaking to Paul in the break, we're doing a review of the priority projects, a review of the work streams. Currently, we're waiting clarification on the priorities for the 5-year forward plan. But naturally, what's fallen out is nutrition in aging people and this collaborative lunch club we're working on. That has to have grant funding because it is a project and we're working with charities. So it's a local and community innovation. And we're doing an engagement piece within that area of need. And then fractional exhaled nitric oxide, this diagnostic for asthma. There's a deep dive that Will McConnell is doing with 3 primary care networks. And we've got agreement from the Dorset Respiratory Network that we're working within those PCNs to look at the implementation. So Pheno has been implemented, but is it being used in the right way as NICE, National Institute for Clinical Excellence, would require us to use it to actually get the reduction in acute exacerbations and the impact to acute trusts. I'm sorry, this one is very clinically based. But that's one of the projects that we're doing, working with the different partners who've had Dorset Council working with us. BCP, the AECC are very central to that, and obviously working with the acute, so Dorset County, as well as UHD.
Thank you. As you say, there's so much more. Who won the posters, the 38 improvement posters that you had shown at that meeting?
It was the health bus, so it was the specialist input. Homeless people, so yeah, we were really pleased with our audience. Sounds
excellent. And just from my perspective, is everyone as all organisations here as engaged with the work that you're doing as you'd like it to be? I mean, opportunities for people to actually get more engaged, I think would be very useful to see.
So in response, everyone is signed up in principle. There are capacity issues. It's about understanding the perspective from the organisation. So looking at, for example, adult social care and the revised programme that's going through council today, and actually how we touch on those points of importance, making sure it links back with a 5-year forward plan. Turnover of staff, losing those capabilities and rebuilding is something we're constantly working on. That's nurturing those relationships. And as we look at changes and we look at SIP programs, it's how do we make sure that improvement doesn't go lower on the agenda when there's a big prevention piece and a big piece looking at the wider determinants of health. I hope that partly answers what you're saying.
It does, absolutely. And Sam, is this an approach that we should be bringing to some of those items that you mentioned earlier on? You know, again, we've heard about sort of being able to resource some of these activities by getting in-kind contributions from partners, using a structured process with some organisation. Is that something that we could be bringing to the
I was having a similar conversation with David in the break. I think as a system, when I think back to the amount of resource and the amount of thinking time that we have to understand where to put the focus and then how to do it properly, following a rigorous process, we've probably got some work to do. But I think that's where working alongside Innovation Hub, understanding methodologies, we can't do everything. So if we're going to do a couple of things, where would we put the focus, and can we actually spend the time to do it properly? You know,
And I
gather
think the key for us is that we are benefit in kind. It isn't, a paid participation, but it's then making sure that it's relevant for each of the organisations as well.
I understand that, but if you're going to work alongside organisations, I suspect a lot of organisations would say, but we're so busy, we'd find it a struggle to identify new time, if you like, to be able to dedicate to something. So I think just entering into that conversation about where is the best value, how do we know it's the next best value thing to be doing, that'd be quite powerful when we're trying to persuade organisations to kind of come on that journey.
And this is where Wessex Health Partners presumably also can step in with some of the data that they have access to as well. Is that something that would be useful? I don't know, Richard, I don't wish to put you on the spot, but talking to Nicola in the past, she's often said, well, challenge us for the data that you need for certain things.
Yeah, and just to clarify, Health Innovation Wessex is part of Wessex Health Partners, because I think you referred to me as Wessex Health Partners there. But yes, we're working very looking at building the understanding of how best to support these particular priority areas based on the information that we have from colleagues around this table, and then how we can feed that in. So yes, if there is a requirement for some data access, we're very happy to support and looking forward to supporting any agenda which helps us accelerate the adoption of innovation that would improve patient care. Thank you.
Thank you. I'm sorry I got the name
That's
wrong.
all right.
Get them confused. Cool.
So I think tying this into the conversations that have happened in the rest of the meeting, there's lots of things that we've talked about that we already know and have known for a long time, but trying to tackle them the way we've always had to do there's been a frustration and a lack of movement. And I think that's where, if we have in here also a conversation and understanding of what is our system capacity, both within our system but also with wider partners like Health Innovation Wessex around innovation, and therefore what's our maturity and our opportunity to actually do things differently rather than just try and make those small adjustments, those small changes, and not necessarily have the big impact that we want. Then I think that's what's helpful to hear here.
Yes.
I think Sam's point is really important. How do you get system partners engaged in innovative approaches when they, just keeping going at the moment feels, very tight. And I think that's where we link it through to what are our agreed priorities, either as an ICP or within our ICP strategy or within the 5-year plan. And that's one of the conversations that I'm going to have with Sarah is how do we align our innovation priorities over this year and next year and so on with those priorities that we've got already identified. And then hopefully we'll be finding common ground. And when we find that common ground and the opportunity, then we're much more likely to get engagement with system partners and actually have the effect that we want to have in the pieces of work we're working on.
Super. Well, thank you. Any further comments, contributions? Leslie.
Yeah, thanks. I mean, just to really commend Sarah and colleagues there, because I think it just shows you what you can do through driving through energy, momentum, a bit of money up front through the Health Foundation has been really helpful. But actually, these things have to be driven and led. And actually, it shows, if you drive things and lead things really well, of course, people come with you and they do come to meetings and they do, provide support in kind. None of our organisations have got loads of capacity, but it's something we're all investing in because it's the biggest sort of so what question. I think we're all interested in that. We're all kind of invested in that. So I think it's been a really, really useful and interesting driver. I mean, it's been obviously led often by the kind of key mandates that are coming down, but I totally take Paul's point there that actually it can really be driven through our kind of priorities closer to home as well, which we've all kind of looked at, whether it's the diet project and those sorts of things where Sarah and her colleagues have been able to bring people around a table. So I think it has been really really incredible to watch the progress of this. So I think it's great that it's now sort of more embedded in the system. Thank you.
Thanks, Leslie. Simone, did you want to come in?
Only very briefly, just to say thank you. That was really, really interesting. And I was just just wondering, do you see there's a role for the Innovation Hub in supporting some of the sort of integrated neighbourhood team work? I've actually just emailed the Innovation Hub myself because I was wanting some support on the project that we were thinking about. I mean, is it that granular, or does it have to be sort of bigger, wider sort of approaches?
We do get multiple requests for support, and obviously we go back to the 5-year forward plan, but it keeps being mooted about working with the integrated neighbourhood team. So we were looking at potentially the Boscombe area, but I think that needs to go back to the programme group for approval. And yeah, I'm getting Paul's nod on that. What we've done is taken it back to the programme group, but obviously now as a centralised service, we need to go through governance here as well. The short answer is yes, let's have a conversation. We can explore it a little bit more. The big question is, what is the need? So a lot of the conversations need to actually drill down to where is the added value? What is the need we would look at from the innovative perspective? So happy to have a conversation, Simone, and I'll we can bring it back to the group if that's okay.
Well, thank you very much, Sarah. I know it was a whistle stop tour, but that was really, really informative. So thank you very much. So we're moving on now to the integrated neighbourhood teams, which I think is it Matthew and Paul's doing it together? Yeah.
It is. You're doing a double act, and I'm going to go up the front.
Matthew's going at the front, and I'm capable of running me.
So next slide, please.
Not fully nominated. Then I'll call. Support.
So apologies to people on screen. I can see you, but you probably can't see me very well. And can I ask who is driving the slides? Thanks very much. So we've got about 10 minutes.
Yes, please. Well, yes, I think we've got a bit longer for this.
So essentially, people have seen the slides in advance. So I'm not going to really talk to them. I'm going to talk to the beginning and end of the slide pack. But what I want to just start to do is to begin with a story, really, which is the story of the work on Portland, because I think this will bring it to life for people. And this programme, so many people are involved in the programme, more people will be involved. The programme is developing all the time. It isn't perfect, so it's got all sorts of gaps in it. But I think it's beginning to take shape, which is fantastic. And I'd like to express gratitude to everybody who has been involved. If you take the work on Portland and you can sort of, there's a thread, I think, which runs through many of the topics that we've spoken about today. If you go back to David's presentation, Portland's important because of the deprivation and social mobility. So it shows up, as we heard earlier, as the third worst area nationally in terms of social mobility. And we know that a conversation has taken place in Portland for some time. So this has really been picked up from the earlier this year as part of this work on integrated neighbourhoods. And what you hear when you come alongside the community on Portland is pride in place, close-knit community. Part of that are the specifics in terms of the local environment. Part of it are the features of the community, so local and voluntary groups. But people also comment on the high levels of deprivation. There's a feeling that the community's forgotten and neglected. There's a lack of service provision, so people are not trusting the public sector. Some of those things are around access to GPs, the story around the community hospital, frustration about access to education, youth services, other activities, concern about mental health services, concern about support for carers, concerns about travel and transport concerns, a real feeling that as the statutory sector, that I suppose really the representatives around this table of the ICP, that we don't work together, that we've got our own agenda, we don't engage properly with the local community, we don't reach out to the BCSE in the way that we could, and we don't communicate very well. So that's some of what we heard, and I think you could replicate that in various ways across most of our communities in Dorset. So in response to that, a group has been formed which really represents us as a statutory sector locally to put together the plan for what we're going to do with integrated neighbourhood teams, or the creation of that team, at the heart of that. And out of that has come things like the establishment of the Portland Local Alliance Group, with a focus on children's services. So where are children and young people on Portland? Interventions around lower limb health, which go from the things which sit outside of the traditional health environment to how we provide services. So there's the Portland Leg Club. There's been a review of diabetes and podiatry services on Portland, how hospital expertise can be better represented in the community. There's been a change in the way in which we communicate with the community in terms of using the free local newspaper and the public sector coming together as one to have a communication point in that, and increased support for VCSE and community groups. So things like a friendly food club being set up. There are steps being taken to review transport links. We've interfaced in a different way in terms of the health apprenticeship programme. The GP practice has been listening to people's problems and barriers accessing primary care, and part of that has fed into the changes that they've made with regard to their telephony system and how eConsult works. So those are some of the practical things that are happening. And then we've looked at the health data. We've spoken about DICE a lot this morning and what's going on with the health data. So life expectancy in Weymouth and Portland falls well below the Dorset average. You know, the same would be true of other areas like Boscombe. Almost 50% of the population have got a chronic health condition. 1 in 4 have got 3 or more long-term conditions. In terms of segments of the population, there's a group of 4,000 people who've had more than 20 GP appointments in the past year. So that group accounts for about 114,000 appointments with primary care. That's replicated in attendances at hospital. And there was a great sense of loss about the past history of the MIU on Portland, provided from a community hospital. But when you looked at what people actually wanted or needed in terms of their health needs, a lot of that was about being able to get a GP appointment, or to see a practice nurse, or support for a mental health crisis, or for an ongoing long-term condition, not really things that are best provided by an MIU. So out of that has come a work programme which will shape the integrated neighbourhood team on Portland. And some of that includes how same-day access to urgent primary care is organised, and employing more extended role advanced care practitioners to offer same-day clinics, how our community teams from Dorset Healthcare link into that. Some of that involves identifying individuals at higher risk in the population of frailty and falls, and taking steps to provide proactive care, which includes signposting to some of the things that we've been describing today. And then we're going on to look at pathways for long-term condition management and to support those high intensity users in a different way. So I wanted to just kind of begin there, because that gives you some very practical examples of sort of what we're trying to achieve in this work programme. And going to the slides, which you've had in advance, I suppose what I wanted to highlight on behalf of me and Forbes is this first slide, to say that actually what we're talking about here is, and I sort of make no apology for this, it begins with how the health family can work together, but it's in the context of that wider agenda around relationships and the determinants of health. So we need to think quite closely in our system about the relationship between the integrated neighbourhood teams and the place-based approach, because if we don't focus, we won't get anywhere, would be my proposition. So therefore, going on to the next, if we can, I'm not going to go through all of this because people have read it, I assume, and Forbes and I can take questions. So keep going, please. Keep going. Keep going. So here, this is what's in scope this year, that the kind of darker bit, and it is about community nursing, practice nursing, the mental health services, primary care, how that links with social prescribing and care navigation. So to take an earlier example, in terms of our philosophy of care, yes, that would include the ability to signpost to things about housing. So how is damp in your house? Okay, you go and have a conversation over here. Have you got problems accessing food, for example? And there's some great work I was hearing about the other day in BCP in terms of food poverty. So it would include the signposting to that, but not active work to change those services. So if we then go on, please, to the next slide, keep going. I could talk about this for ages, but I'm aware of time, so keep going. I want to talk about outcomes. Okay, and stop. So in terms of sort of what we're trying to affect, so you've got some words up there which are really important in terms of our ambition statements, but just to sort of bring this to life for people around the table. So with this programme, what we want to see as outcomes are reduced rates of admission into secondary care in an unplanned way. When people are admitted, we want people to come out of hospital more quickly, so reduce length of stay. So for some of the things that are driving our costs in the healthcare system, that will have a real impact for health. For the local authority colleagues, it should also have an impact in terms of the costs of long-term healthcare needs should come down. For people who are interested in things like population activation measures, how much do people feel in control of their health and well-being? We could do with some research infrastructure support to allow us to measure this in the right way across the Dorset system, but we should see those things go up. And again, that's a real marker of the effectiveness of a health system. We should be able to support primary care by attendances going down, by working with some of the groups that I've described and helping to provide care in a more coordinated way. And for inequalities, we should be able to make a real difference, which means that we won't be using our resources equally. We need to target them in terms of our interventions. Going back to Sam's earlier population groups, that means some of our markers will be hypertension being more controlled in sections of the population where control isn't good at the moment, frailty outcomes being better, and people having evidence that their COPD escalation is planned for in advance and asthma medication is better. And I would say we've got lots of evidence to show that for the most deprived parts of our population, they come out worst on those measures at the moment. So then I'm going to go on to the final slides, please. So keep going, please. So we've got a programme to do this, and go on to the next one, which is the very final slide. So we've got a programme to do this, which is very ambitious. The NHS is much better at talking about this than it is about delivering it. We're trying to deliver a new model of care which will transform our out-of-hospital services in the community. We're working for the moment with the National Association of Primary Care on this, so we've got a real expert view helping to give the system more bandwidth. We've got a programme which goes through the year. It is ambitious. It begins with the identification of 4 early adopter sites. I've spoken to you about the work on Portland, and we want to get that work going as quickly as possible in 3 other areas. We then want to have developed a blueprint which can be rolled out elsewhere. The governance structure, just to cover the boring bits, but these are important, is that in the system we've got an integrated neighbourhood team programme board. So some people in this room sit on it, Paul sits on it, which is great. Sam is on it. Forbes and I co-chair that board, and we're the joint sponsors of the work. And in terms of reporting points, the work reports currently to each health and wellbeing board, and I would say that that's pending the development of place-based partnerships because of that link that I showed earlier on. So it would be great to get those place-based partnerships up and running. That would really help, I think. And the work also reports into the provider collaborative, because clearly this is, from the NHS family point of view, a really important thing that spans primary care, community care, mental health, but very importantly, both acutes. So the link with our University Hospitals Dorset partners is incredibly important, and via the provider collaborative through to the system escalation group. So that's kind of how it works. So that is the programme in a nutshell, and very happy to take comments and questions today, and also to return at a point in the future to keep telling the story about how this is making a difference for people. Forbes, before passing back to Cecilia, would you like to add?
I think that's a very helpful overview in the brief time that we have available, Matthew. And as you said, the slides are self-explanatory. So to use a sort of COVID analogy, I think the train has now left the station, but we're still getting people on board and working out where our final destination is going to be, and it won't be the same destination for all of our communities, because they're different in terms of their demographic, they're different in terms of the characteristic. Matthew said this is an out of hospital partnership, effectively between health and our local authority partners. It's not an exclusive club. Our acute colleagues can do a huge amount to support this, particularly in terms of outreach, so they need to be engaged in the conversation. It's absolutely about co-design and co-delivery of the model of care wherever we get to within each of our communities. And there's an issue about phasing. So there's an issue about what are the quick wins, where can we actually just work better together? It doesn't need a 5-year strategy to do that. Back to the talk and no action. And then there's a slightly longer term, but not very long term strategic plan, as I say, based on local need. Actually, a lot of that information is there. It's just about pulling it together. And we want to do that, as I say, very much from the bottom up, rather than a prescribed and directed model from above. So work in progress, starting to make progress. Very helpful to have National Association for Primary Care on board. And tomorrow we'll be having a conversation with GP colleagues, and that will continue at the steering group on Thursday about how we phase the implementation of this across all the communities of Dorset over the next 12 months, if possible. And it wouldn't be that if you're not first, then you'll be last. It's quite the opposite. It's just going to be, everyone's going to be involved. It's just what the phasing of that's going to be. And again, we didn't want to be too prescriptive. We want people to say, actually, we're ready to go now or not. We'll need a bit more support, but we'll be ready in a few months. So,
I mean, that's really comforting to hear about the fact that it will be bottom-up driven, that you are adapting to local communities, and that opportunity for people who are ready to be able to come in. I've got Sam, David, and then Simone. So Sam.
Thank you, Chair. Apologies, I'm going to have to dash for another meeting fairly shortly, but I was quite struck by your slide, which is about how will we know this will be different. And I would love to see us go down the route, rather than complex research around health activation. There's 3 questions which the Nuffield have developed, which I think are really simple. They've been asked in the GP survey, I think, before, and they're along the lines of, I feel involved in decisions about my care. I have the support I need to manage my condition, and I feel part of the team involved in my care. And I think some really simple questions like that, if we could start to collect experience really quickly, that will give us a good signal as to whether the kind of the feel within those teams is starting to change. So that's my early pitch.
So good measures of health activation.
Yes, I know, but if we call it health activation, I worry the public will lose faith. That's the point.
Good point, Matthew. I was just going to say, but that sounds exactly like health activation to me. So absolutely brilliant. And I'd like to come to Kirsty at the end of this to see if there's anything more that we could be doing engagement-wise on it. Thank you, Stan. Really, really good.
So earlier on in the meeting and through section 4, each of the 4 presentations we had was really, really good. But I sat here thinking we have a leadership challenge. How on earth do we really bring those things together? So Matthews, and I know about the neighbourhood teams, but there's something for the ICP, I think, to learn about the leadership model that's been set up for helping us, because it's focusing place, but then for the health needs of place. And there is a way in which the need and the users are driving the program rather than the providers of all the good stuff that could be there. And I suppose one of the encouragement would be to learn about the essential elements of the leadership model and see how transferable it is when we go into other places, because it may differ, but I'm sure the principles were there. Because I think it's, I know it's kind of the governance in a sense is the boring bits back. It's the way in which we can really get all the great effort focused and delivered out to the users of the service.
Simone?
I did put my hand down actually, but I suppose I will say what I was going to say. I think, again, just thinking about those outcomes and health outcomes, and I think the activation element is really important that we make sure that's considered, because that kind of gives us a whole picture of the sort of wider determinants of those achievements. And I know that the NAPC are actually working with Claire Fuller, and they've got a tool that's really, really impactful. So I think it's really important that we don't become too health focused in our outcomes. So I think that was the first thing. And the second thing, I guess this isn't probably for this forum, but, you know, I'm a jobbing GP on the ground. I am really, really enthused by neighbourhood teams, and I do see that they're really vital to change how we deliver healthcare and become a more proactive, preventative system. But I guess my question to Matthew is, for me, what happens when I'm on the ground and I have a community team pushing back at me because they say that what I'm suggesting as leader of our INT, for example, doesn't fit with their proposed KPIs, and they can't join in with the teamwork. And I know that we'll probably be dealing with that through the NAPC, but I just wondered, what are your thoughts, Matthew? Because I'm kind of sure that will come up as we have our neighbourhood conversations in the near future.
I'll take your lead as to whether you want me to answer that now or you want to take the other comments and for me to answer as a block.
Well, I think you've had a number of comments there, so that is one of the questions, and I think one of the things that you did cover in your presentation is that the NHS still has work to do with that fragmentation piece. So I think it's reasonable. But yes, please take those.
Great. Well, I'm just responding to that, Simone. Essentially that will happen. So this is not simple. And when you get into the rooms with people to do this work, there's a diversity of view. And if we try and do everything, then we won't make progress. So I think it's about having the right environment so that we're listening to people's voices in the right way. And then our decision making also runs in the right way. And let's not underestimate the challenge of what we're trying to do here. We're trying to change the face of the NHS and how it works in our local communities to get to the heart of much of what we've been speaking about today. And from a Dorset Healthcare point of view, as Dorset Healthcare being the community and mental health provider and the ICS wide provider, we need to. This is about changing the operating model within Dorset Healthcare. So there's a lot of change that's required. So it's going to be a big journey. And Simone, I want this to be as far as possible, both led by the communities, but as we do the more technical aspects in terms of changing the way health is delivered, for clinical leadership to be at the fore. So the voice of you and colleagues is always one that we need to listen to, which isn't quite the same as saying that I can guarantee we're going to agree with everything that is said, but we'll need to work those things through.
I think it is a listening, and that flex to the local requirements that you mentioned, I think is where you're going to be successful, because those local GPs will be those that will be able to help direct that. But it is a massive challenge. Don't underestimate it, Alice.
Thank you. It was just a comment related to Portland LAG, so Portland Local Alliance Groups. The local alliance groups are really well established in children's services. So Portland is the 7th, where we have 6 localities in recognition of its difference to Weymouth. Otherwise, I had 1 LAG area and 2 local areas that were quite different. And Sarah Howe has done an amazing job of chairing that space. And I suppose my ask would be, is there more opportunity, or my question would be, is there more opportunity with those other local alliance groups that are well established through children's to think about how we can support as this develops further through those? They are forming the governance structure for family hubs, so thinking about the health that gets discharged, the opportunity to discharge health services through those family hubs. So there's just an opportunity there, I think, for us to continue that work that's been done in Portland in other areas, if you think that would be helpful.
Yeah, no, thank you hugely. And you know, in telling that story, there's never a clear and clean start point or finish point. So what I've described, there's an example of something that was happening anyway, as it were. So the question for this work is, how is it adding to it in an additional way? And then in terms of the 7 groups that you describe, I'm not making a specific comment on those, but part of the change, the question about change across the public sector is, our health teams are not aligned within health to geographies, and almost everywhere our health and social care teams are not aligned. Sometimes there's a difference for adults and children. There's frequently differences between mental and physical health. So part of the question here is, how much of that do we want to align? And so what we're doing at the moment, the rollout plan isn't within the slides today, but the rollout plan at the moment is based on local authority areas. And that, if you want that co-working of teams together, that coincidence of the boundaries is quite an important issue.
Thank you. I've got Leslie and then Forbes who want to come in. Leslie?
Yeah, thanks, Cecilia. I'm sort of struck by some of the comments, quite rightly, about actually where is the leadership and how do we know where we're going and when it's going to be successful while we wait to measure the outcomes. But I was sort of struck with some of the work that we've been doing even locally here in Boscombe, that actually it's the conversations that are the tensions that get created between what local community wants and actually what we all sort of think would be the areas to move people to. And actually that creates incredible creativity, and it allows an opportunity for us all to get onto the same page and understand what the data really is saying. And so that, that part of that the strength, I think, is in the dialogue. Which is why I'm a huge supporter of this sort of approach. So thanks, Matthew and team. I just think this is such a positive way forward. So thank you.
Just fine. I mean, there's a huge opportunity here, but it is a challenge. Yeah, it absolutely is a challenge, and we have underpinning residual sustainability issues with this as well. But not solving itself. So it's one piece of other parts of work that need to be done. But I do believe this will be extremely helpful in many elements. I just wanted to respond to the leadership challenge point, because it's an important point, particularly for those in this room who are leaders either of organisations or at system level. I would ask you to do what you can to enable this, please. I know it's not easy, but either through distributed leadership, delegation, enablement from a senior level, because at a local level, we can start the conversations, but they will need to feel supported from those on high in order to make it happen. And that can be a challenge for executives at an individual level. It can be a challenge for boards, and it can be a challenge for organisations. And therefore, I think I would ask all organisations just to give us some thought as to how they might help progress this.
Thank you. And I think it's about listening to each other. If someone is saying this isn't working here because, then you know, listening into that and working out how you can change what you're doing in order to be able to make it work.
If things are a real challenge, then best we hear about it.
Absolutely. And I think, you know, not that the idea that one size does not fit all is absolutely clear, and the opportunity to work across those.
And may I just make a final comment too, which is just building on what Forbes has said. What we're trying to create here is, I suppose, a bit of a movement for change within the system. And Forbes and I, Dorset Healthcare and the GP Alliance can't do all of this. So, you know, began by thanking partners. But this is in the true kind of tradition and meaning of a social movement for change. We want people, your door is open, you don't need to knock, just barge straight through. So in terms of, for example, some of the local leadership, if there are people engaged in the Boscombe area, I'm looking at Leslie as I can on the screen, who think actually we need to stop talking, we need to begin running with this, and I've got a really clear view about how some of this could happen, come forward, because that's the kind of leadership that we need, and we haven't got a kind of cavalry division in reserve that's going to come over the hill and do all of this. And for some of the organisations around the table, and I know the local authorities really are, I think, leading the way, both local authorities in a very effective way in terms of thinking about this. Can you, the plea would be in a tangible way, can you think about how this agenda might change how you organise your focus? So, for example, within DCH, essentially what we're doing is positioning people in the leadership team who are focused on this. Siobhan is starting to think in a similar way within UHD, but that's the kind of practical input that we need from partners to make this succeed as a collective endeavour, I think.
Thank you very much indeed for the work. Thank you for the presentation and the great discussion. And I think you've got a lot of people in this room who and on screen who will barge in and say so. So I don't think we're too shy about coming forward. So thank you very much. And yeah, let's know about it if we need to make some changes. So you'll be delighted to hear that the last item that we had on our agenda, we had prior to this meeting agreed that we would defer it to our next meeting. So thank you to Jonathan and to Teresa for providing some really excellent reports which do feed into how we're working together. I think we do need to have that discussion whilst Julian is available, and she was not going to be available for this meeting. So we'll defer that to our next meeting. But there is a lot in those reports that gives you heart that things are starting to work, that place-based working and system-wide working is actually happening and making a difference. So thank you for the reports, and yeah, let's have a good discussion next time. Zoe, did you want to come in? Oh no, we've got, okay, yes.
Sorry, no, I was just saying, yes, that's great, and that's absolutely music to my ears, the last, well, all today, but that last segment, thank you very much, and I won't be afraid of leading through the charge, as you that know me know that'll probably be where you've given me the green light, guys, thank you.
Come on, watch out, she's on her way. Do we have any questions from the public? We have no, we have no questions from the public. Do we have any other? We have no other items that were pre-notified. Anything else? I think Jenny's point earlier on that we do need to get our work plan into the next one, which we will do. Key messages. Anyone want to highlight anything? Liz, did you want to pick up some of the things that you might have picked out, or?
I've made some notes to the escalation report that will go into the ICB board. The sort of umbrella for that was that we reiterated our commitment on the 4 ICP priority areas. And we were considering how those relate to the ICP strategy and system working. And I've made some comments on those in the programme updates we've had today as well.
Okay, and Leslie?
Can I just let everybody know, sort of putting us out of our misery, that we've finally had approval to call ourselves Health Sciences University. So AECC, by the sort of 1st of August, you'll see it sort of drifting away, will become no more as an entity. So it was just to let people know. Finally, we've taken over a year, but we're finally there. So
congratulations, well done.
Yes, thank you.
Yes, absolutely. Any other business? No. I think we have the date of the next meeting is the 22nd of October. Venue to be confirmed. So yeah, we'll find somewhere to have that meeting. Thank you, everyone. Such great discussion, and I think we have moved a number of things forward. We at least we know what each other are doing, and we have some plans to actually put some resources behind some of those activities. So thank you very much indeed. Okay, thank you.